Halo, halo, selamat pagi.
Iya, selamat pagi, Pak.
Ya Bu, mau tanya ini jadinya mulainya jam 9.30 atau jam 9?
Bu Ria mana ya? Bentar, Pak. Kita briefing di WA gimana, Pak?
Ya?
Kita briefingnya di WA ya?
Oh gitu. Terus
Ya.
mau tanya soal sesi tanya jawabnya juga sih, mekanismenya gimana?
Oh ya, nanti saya coba kita confirm di WA ya, Pak ya.
Robo udah masuk.
Yang belum bisa, ini soalnya live terus, live yang belum. Suara saya udah masuk, tapi saya nggak dengar. Oh ya.
Jadi belum kita Assalamualaikum. Assalamualaikum, Bu Lia.
Ya, waalaikumsalam.
Oke, bisa kita coba tes Bu Lia?
Tes, oke, gimana nih?
Oke, udah live ya? Oke. Oh, masih pakai background yang ini ya, Bu Lia ya?
Salah ya? Backgroundnya salah?
Oh,
Tunggu, tunggu.
Bu Lia belum share ya? Oke, wait. Kita kirim lagi ya, Bu Lia ya?
Oke.
Oke, ya.
Sudah? Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen in Indonesia and in India. Hello, everyone. Can you hear my voice? Okay?
Yes.
Okay, thank you. Good evening for our our speakers and in New Hampshire. Hello, Mrs. Stacy, Tony, and Lindsay.
Hello.
Hello. Okay. Good evening,
Hello.
right, in New Hampshire?
Hello.
Hi, this is Tony.
Okay. We proudly present the International COVID-19 webinar by Stikes, Yatsi, and Alma University. It's been a great honor for me, Diane, to be here, to be your host, and welcome each and everyone. Before we process the program today, we would like to
Leah, you're muted.
Yeah, we lost sound. I think you're on mute. I think you're on mute.
and Indonesia. Honorable distinguished the second is video profile of Stikes Yatsi, and the third is video of Indonesian anthem, and the fourth is speech from Mrs. Ida Farida, Bachelor of Nursing, Master of Health, as the head of Stikes Yatsi. And the fifth is webinar session 1 with the title is the Public Health Insight into COVID-19 Pandemic. And the sixth is webinar session 2 with the topic Health Education and Technology during COVID-19. And the seventh is the webinar session 3 with the title is Nutrition and COVID-19. And the last one is closing. Okay, now let's we open our webinar by saying Basmalah together. Bismillahirrahmanirrahim. The next is video profile of Stikes Yatsi. Let's hear it is and keep watching. Okay, please wait for the video, right?
Suaranya tidak ada ya, Mbak?
Okay, thank you for watching, and we move to listening our Indonesian anthem. Please listening and watching. Thank you. Okay, thank you for watching. our anthem, and the next agenda is speech. The speech will be delivered by Mrs. Ida. For Mrs. Ida, time is yours. Yeah.
Kalau ada yang ngomong,
Tidak tahu caranya.
Oh, Mrs.
Halo nurse. Morning.
Lagi ganti nama.
Sorry, we can wait for Mrs. Ida.
Assalamualaikum warahmatullahi wabarakatuh. Good morning and good evening. The Honorable Dean's lecture participation, the COVID-19 webinar series, the new challenge, the spread virus that are so easy cause the death of the human. Based on we have 19 cause the die until 300,000 people in the world. And this pandemic affect of the various aspects of human, including the life, health, including health and education. The organizing committee has gone to great event, memorable event, and ensure the presentation and content about the challenges COVID-19 to the public health and higher education. This webinar will be delivered by experts from USA and Indonesia. The purpose of this webinar is to increase community preparedness and education during the pandemic by making this pandemic as a challenge, so we can make the intervention to head this pandemic. And I would like to thank you to the committee from the Yatsi and Alma University. And I want to say to the speaker, to Tony, Stacy, and the other speaker, and have the nice webinar this for today. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Okay, thank you, Mrs. Ida, for the speech. The next, I will read a curriculum vitae for our several moderator. Okay, this is the curriculum vitae. The first webinar will be led by Dr. Arif Sapta Aji. Dr. Aji is a lecturer in Nutrition Department in Alma University. He is a member of Indonesian Nutrition Scholar Association. He is a member too in International Young Food and Nutrition Leadership, or IULEAD. His interest research focus on establishing the role of micronutrients and lifestyle in the prevention of malnutrition and pregnancy complication. He's an active too in another professional membership in Nutrition Society, like in America and Indonesia. Okay, this is the curriculum vitae for Dr. IG. We are moved to the second session. The second session will be led by Mrs. Zahra Maulida. Okay, here is he. Bachelor of Nursing, Master of Nursing too. She is a lecturer on Nursing Department and the head of Quality Assurance in Stikes Yatsi Tangerang. She has some publication on national and international journal with focus in nursing care as and the special in surgical medical. She's an active too as a member of Indonesian National Nurse Association and member of Emergency and Disaster Nurse in Banten, Indonesia. Okay, this is the curriculum vitae for Mrs. Zahra. Okay, we call her Mrs. Zahra, right? And the session 3 will be led by Mrs. Rina. We are moved to the curriculum vitae for Mrs. Rina. Okay, here is she, Mrs. Rina Puspitasari. Ms. Rina Puspitasari, Master of Nursing, Specialist Community of Nurse. She's a lecturer in Nursing Department in Stikes Yatsi Tangerang 2. She's a member of Indonesian National Nurse Association and member too in the Association of Occupational Health Nurse. She has some publication to national and international with focus of community nursing. Okay, that is the curriculum vitae for our several moderator. And now I will read the rule in this webinar. The rule is for all participants. Okay. Okay. All participant accounts will be moved automatically by the host and only be open at certain session. Jadi keseluruhan partisipan di sini memang suaranya sudah di-mute atau diredam oleh host dari panitia webinar ini dan hanya akan terbuka pada saat-saat tertentu saja. Jadi dimohon tidak unmute secara manual ya. And the second is the meeting will log at 9:10 PM. Sorry, waktunya ini sudah lewat ya. Jadi memang sudah terlog, and participants are not permitted to leave the forum. Partisipan tidak diperbolehkan sama sekali untuk meninggalkan forum. The third is question in each session can use the raise hand icon or write question on chat. Jadi untuk sesi pertanyaan akan ada pada setiap sesi webinar. Karena ada 3 sesi ya, webinar sesi 1, 2, dan 3, maka akan ada pertanyaan pada setiap sesinya. Dan yang ingin bertanya bisa menggunakan icon angkat tangan, itu biasanya ada di sebelah kanan, di tanda titik 3 di sebelah kanan. Atau menuliskan pertanyaan pada forum chatnya saja. The fourth is a certificate will be sent only to participants who take part in the webinar, even to finish, and fill in the evaluation form until 3 PM. sertifikat hanya akan dikirimkan kepada partisipan yang mengikuti acara ini sampai selesai dan mengisi form evaluasi yang akan dikirimkan setelah webinar ini selesai dan dikirimkan kembali maksimal pukul 3 sore nanti. The link of certificate of webinar will be sent via email. Jadi nanti sertifikatnya akan dikirimkan ke email masing-masing yang sudah didaftarkan oleh partisipan. Okay, that is the rule of this webinar. Now we are moved to the core event, the webinar session 1. The webinar session 1 with the title is The Public Health Insight into COVID-19 Pandemic will be led by Dr. Arif Sabtaji, or we can call he Dr. Aji. Dr. Aji, can you hear me?
Yeah, hello.
Okay, now Dr. Aji, this is your time, please. Thank you.
Okay, okay, thank you for introducing me, Leah. Welcome to our international webinar in the COVID-19 webinar for all participants. This international webinar is initiated and collaborating between the University of Alma, Institute of Health Sciences, Yatsi Tangerang, and also we have a guest speaker from the Southern New Hampshire University from America. And in these first discussions, we will talk about the public health insight into the COVID-19 pandemics. It is my pleasure to lead these first discussions in this first panel discussions because we have three panel discussions in these seminars today. And I am Arif Sataji, and you can call me Aji. I am a lecturer in the nutrition department in the University of Alma Ata, Yogyakarta. And also, I'm glad that this webinar already have 100 participants. Or the last night, I have currently updated about 3,000 registered participants to will be joined today in the seminar in this COVID-19 webinar. And I want to say hello and good morning for the participant in Indonesia, and also good morning for or evening or good night for our guest speaker in America. I think it's night times in there. And before we starting discussions, I'm gonna talk about how the COVID-19 pandemic in public health now. I want to share the updates that now we are facing a new normal during this pandemic. Frankly, this kind of virus that caused the pandemic was happened previously, like a Spanish flu back 100 years ago that caused about 675,000 people died in the United States during the 1918 Spanish flu pandemics. Although we are only a few months into the COVID-19 pandemic, there are currently many similarities to what we saw then. This COVID-19 now have raised 5.76 million confirmed positive cases in worldwide and about to 358K or thousands people was died because this pandemics. Today we're gonna talk with two expertise about how this COVID-19 pandemic affect for protecting vulnerable communities and also the student and alumni in the daily work activities. We have Lindsay Kos from the Southern New Hampshire University. Hello, Lindsay.
Hello, how are you?
Hi, I'm good, thanks. How's everything in the US?
It's good. It's about almost 11 o'clock at night, so you'll see me take sips of my coffee throughout the evening. I'm excited to be here.
Okay, and then I want to say hello to Nurse Christina Aferencia from the Stikes Yatsi, is a guest speaker from this Institute of Health Science Yatsi. Hello, Christina. Okay, so committee, is there Miss Christina is in our Zoom meetings today? Hello, Miss Christina, can you hear my voice? Okay, let's jump to our first round discussions of the first session of this international webinars. Today, I will introduce our first speaker, is Lindsay Coase. She is a faculty lead in the Southern New Hampshire University, and right now she pursues a PhD in nursing practice in University Massachusetts, and she will present about the protecting vulnerable communities from the impact of COVID-19. Please welcome Lindsay Ghost. The time is yours. Please go ahead.
Thank you so much. Am I able to share my screen?
Okay, good.
You can see my slides? Okay, perfect, great. Well, welcome everyone. Thank you for being here. I'm excited to get us started. Let's see. So as I said, it's late here in the US. My name is Lindsay Goss, and I'm a faculty lead in the Nursing and Health Professions Department here at Southern New Hampshire University. I teach in the undergraduate nursing program and in our Masters of Public Health program. I started out my career, as you can see, a little bit different. I started out with a BA in psychology and a BS in molecular, cellular, and developmental biology, and found my calling as a nurse when I started working as a nursing assistant, and I was almost done with my bachelor's degree. So I went back to school, I got my master's, became a certified nurse educator, and now I'm in the process of getting my doctorate in nursing practice with a specialty in public health nurse leadership. I should be graduating next May of 2021, and my studies have focused on vulnerable populations, in particular, working with children, adolescents, and young adults. So as I said, I'm very excited to be here with you all to discuss how COVID-19 is impacting vulnerable populations, both here in the US and a little bit across the globe. So by the end of today's presentation, I hope that we'll be able to explore some of the impacts COVID-19 are having on vulnerable communities, identify some of the mental health impacts of COVID-19, and discuss some strategies to improve health outcomes for these populations. There is so much new and emerging information. Honestly, some of the talking points that I'm going to talk about this evening, really someone could spend an hour or more. And so this presentation is more of an overview, and there is still so much more to be learned about this pandemic and from this pandemic that we can do to, as healthcare providers to help these vulnerable communities. So I just want to start out with a general overview of what COVID-19 looks like in the United States. As of May 28th, which was yesterday for us, the total cases reported by the Centers of Disease Control and Prevention were just under 1.7 million, and a total of 100,500 deaths were reported. The clinical picture of COVID-19 really ranges from mild symptoms to very severe illness, which results in death. This wide range of symptoms makes it difficult to clearly identify without testing people. Those who are 65 or older are living in nursing homes or in long-term care facilities, or those who have underlying medical conditions are at a higher risk of severe illness. There are a variety of hotspots throughout the United States and across the globe where outbreaks are happening. It really is changing every day. So as I've mentioned already, data is still emerging, but the data available so far is suggesting a disproportionate burden of death and illness among racial and ethnic minority groups. The research and information I'm going to share on this slide are from the United States, but they may also be applicable to other communities. A recent report included race and ethnicity data from about 580 patients who are hospitalized with a confirmed COVID-19. And what they found was 45% of individuals where this race and ethnicity data was reported were white compared to 55% of the surrounding community. 33% were Black compared to 18% in the community, and 8% were Hispanic compared with 14% in the community. And what this suggests is that there's an overrepresentation of individuals that are hospitalized that are Black in the United States. In New York City, death rates of Black individuals were at 92.3 per 100,000. Hispanics were at 74.3 per 100,000. Whites were at 45.2 per 100,000, and then Asians were at 34.5 per 100,000. The Center for Disease Control and Prevention has identified 4 different factors which may be influencing some of these racial and ethnic minority groups and making them more at risk and vulnerable to COVID-19. The first thing is living conditions. So members of racial and ethnic minority groups may be more likely to live in densely populated areas because of institutional racism that exists within the United States. And this is really a form of residential housing segregation. This can make it more difficult to practice preventative measures such as social distancing. Research has also indicated that racial residential segregation is linked to other adverse health outcomes and underlying conditions, which already put this population at a higher risk of getting sick and having those pre-existing conditions. Many members of these minority groups may also live in neighborhoods that are farther from grocery stores and access to other resources, which makes it difficult to receive care if they're sick and have easy access to the resources that they might need to be able to stay close to home. And this population may also be more likely to live in multi-generational households, making it difficult to protect those who are over the age of 65. Finally, in the US, racial and ethnic minority groups are overrepresented in jails, prisons, and detention centers. And in these facilities, people are in close contact with one another. And again, it's hard to have that social distancing. In terms of work circumstances in the United States, critical and essential workers continue to work outside of their homes and be at a higher risk to outbreaks within their community. In the United States, about 25% of Hispanic and Black workers are employed in this type of job as compared to 16% of non-Hispanic whites. There may also be a lack of paid sick leave, meaning that someone may have to continue to work and expose others in order for economic circumstances to be able to keep money coming into their household to pay for their needs for daily living. The next two factors that I identified here from the CDC are underlying health conditions and access to care. So there are already existing health disparities in the United States, which may make these populations especially vulnerable to public health emergencies like the COVID-19 pandemic. Examples can include not having health insurance, having already underlying medical conditions, and then stigma and systemic inequalities that exist. So according to one author, Bartel et al. In 2019, Hispanics are 3 times as likely to be uninsured, and African Americans are almost twice as likely to be uninsured when compared to non-Hispanic whites. And according to Cunningham in 2017, compared to whites, Black Americans experience higher death rates and higher prevalence of chronic conditions. So here, I'm going to talk a little bit more about a few other vulnerable populations. Information shared on this slide is not just specific to the US. There is some information from other countries and around the globe. So I'll start with talking about impacts on men and women. And there appear to be an equal number of COVID-19 cases between both men and women. But there does seem to be some sort of sex difference in mortality and vulnerability. There's still emerging evidence, but it is suggesting that men are dying more than women. This could be due to immunological or gender differences such as smoking patterns. But the current data is still incomplete, so researchers are cautioning against any early assumptions related to this. This was from Chen et al. In 2020. According to the United Nations Department of Global Communications, women make up 70% of the frontline workers in both health and social sectors. So that means they're at the front lines caring for these patients. They're out in the workforce and they have those essential jobs. So the UN Women issued a checklist for governments, and this resource can be found on my last slide. According to Dashrath et al. In 2020, outcomes of 55 pregnant women infected with COVID-19 and 46 neonates have been reported in the literature. So really, so far, there's no definite evidence of any vertical transmission. However, pregnant women are more susceptible to infection and should take the appropriate precautions to reduce the risk of COVID-19 infection. United Nations leaders, advocates, and humanitarian experts have really been alarmed by the ability of this pandemic to overwhelm some of these vulnerable communities. In particular, refugees, migrants, women, and girls who are already challenged by disparities and hardships. One example provided by Herlinger in 2020 is that self-quarantine and social distancing are not really an option for example, for 600,000 refugees who may be confined to one area. Other concerns include increases in domestic violence and child abuse. The United Nations Children Fund warns that children will be facing increasing threats to their safety and well-being, including mistreatment, gender-based violence, exploitation, and social exclusion and separation from caregivers. Children across the globe are also temporarily out of school, which may increase rates of dropout, And I know here in the US, and I'm sure in other countries, there's also an increase in food insecurity for these populations. These children may have been getting their meals at school, and now they're not anymore. Another concern for children who have been infected with COVID-19 is something called multi-system inflammatory syndrome in children, or MIS-C. This is a syndrome in which different body parts become inflamed, including the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs. There's still a lot to learn about this syndrome, and the exact cause is still not known. It can be serious and deadly. However, the CDC reports that most children diagnosed with this condition have gotten better with medical care. The World Health Organization has also warned that COVID-19 may disrupt other routine vaccinations, leaving children at risk for other diseases like diphtheria, measles, and polio. This is due to disruption in healthcare services. The next vulnerable population I'm going to discuss are those with disabilities. According to the United Nations Department on Global Communications, very little is being done to protect those with disabilities. Individuals with disabilities may rely on others for support, for example, bathing, getting dressed, and eating. Many people with disabilities may also have other underlying conditions making COVID-19 more dangerous for them. And now on to elderly persons, which I've already spoken to. Those who are over age 65 are the highest risk, especially those with pre-existing medical conditions. Those who reside in a long-term care facility or a nursing home may have additional risks. These individuals may have difficulty social distancing due to the need for assistance with activities of daily living and also being in that confined area. The last population I'm going to mention here is the homeless. When it comes to COVID-19, there are challenges to both homeless individuals that need to sleep outdoors or those that are in an encampment type of shelter. So outdoors or sleeping in unsheltered areas, there's difficulty accessing hygiene, sanitation facilities, and connecting with healthcare services. And while staying in a shelter may help with some of those factors, it doesn't allow for that social distancing that may be able to happen otherwise. So again, this is a really broad overview that I've just provided on vulnerable populations. There's others out there. These are just the ones that I'm discussing here this evening, or sorry, this morning for all of you. And now that we've taken some time to really discuss these populations, I want to provide an overview of sort of what can be done. So history does tell us that death rates tend to be higher for these ethnic and racial minority groups and for these vulnerable populations. As I've described in some of the previous slides, this can be especially be the case during public health emergencies like the COVID-19 pandemic. Common sources of support for some of these vulnerable groups are shared faith, family, and cultural institutions. These common sources of support can empower and encourage individuals to take action to prevent the spread of COVID-19. The CDC has a variety of recommendations from the federal level all the way down to the individual level to support these vulnerable populations. So I'm going to take some time to describe some of those. In the US, the federal government is collecting data to monitor and track disparities among vulnerable groups, including cases, complications, and deaths. The hope on the public health side is that this data can be used to inform clinical management, allocate resources appropriately, and target public health programs. The CDC also has guidance documents for a variety of organizations. A link to these guidance documents can be found on my final slide. Public health professionals ensure clear communication about COVID-19. They work with sectors such as faith-based organizations, businesses, and housing organizations. And these can link racial and ethnic minority groups to healthcare services. An example could be getting them access to the needed treatment, medications for an underlying condition, and testing or treatment for COVID-19 symptoms. Community organizations can prepare community health workers to support underserved racial and ethnic communities. Leverage health programs which are already successful to disseminate information and resources, and really work to connect people with various services. To promote precautions and to protect individuals. It's also important to provide credible information and to really combat some of the rumors and misinformation. Healthcare systems and healthcare providers can standardize protocols. I know locally, a lot of the hospitals and facilities in my area have different standardized protocols now. When we had to be seen in the ER the other day, both my daughter and I were both screened immediately as we were walking into the emergency room. When we had follow-up doctor's appointments, we're waiting in the car before we enter the waiting room. They have different strategies to make sure that we're reducing the risk of exposing others and exposing ourselves. Healthcare providers also need to be able to address implicit bias, provide medical interpretation services, reduce cultural barriers to care, connect patients with community resources, and like we're all doing here today, learn about conditions which may put patients at a higher risk of getting sick from COVID-19. The final recommendation from the CDC is to promote a trusting relationship. One of the challenges here is that promoting a trusting relationship takes time. It doesn't happen in one visit. And with the some of the challenges that already occur for these vulnerable populations, gaining that trust is a challenge. On an individual level, I've shared something from the CDC on the side here, but individuals should seek medical care if they're exposed to COVID-19 and develop fever, cough, or difficulty breathing. And they must also take steps to protect themselves and others from getting sick. Other recommendations from the CDC include coping with stress and finding ways to connect with friends and family while limiting face-to-face contact with others. According to the Economic World Forum, wealthy countries are struggling to detect and contain COVID-19. This challenge is also happening in low-income countries and in low-income communities throughout the world. And this really proves as a big challenge for us. Like the CDC, the Economic World Forum also recommends building trust and awareness. They suggest designing customized communication methods that focus on symptom identification, hygiene, and sanitation, all while also remaining mindful of language, culture, customs, and faith-based and spiritual leaders can kind of help with developing that trust and raising the awareness. They also recommend special campaigns focusing on children and adolescents who make up a large portion of the refugee populations. The other recommendation from the Economic World Forum is to support government responses. One way to approach this is through innovative partnerships. Darwaza and Raful from 2020 recommend global response partnerships such as interpersonal governmental response and public-private partnerships. Another thing that can be done is to test, which is what the World Health Organization had recommended. This is because testing can contain COVID-19 outbreaks. Large-scale testing allows health services to quickly identify who has the disease and then arrange for them to receive the care that is needed and isolate those known cases from others. This really does a great job at decreasing the rates of transmission. So that was really what we can try to do as communities. Again, a broad overview on an individual level and on a community level. We need to make the choices that are best for our communities to decrease the risk of COVID-19 spreading. One of the other big challenges is the mental health impacts. COVID-19 is impacting mental health across the globe. And according to Torres et al., the COVID-19 global outbreak is leading to additional health problems. These health problems include stress, anxiety, depression, insomnia, denial, anger, and fear. These can influence our daily behaviors. They can influence the economy. They can influence the prevention strategies which are out there and decision-making that policymakers are having. They can influence health organizations and medical centers. And all of these influences can really weaken a COVID-19 control strategy and lead to higher morbidity and mortality rates. The American Psychological Association also shared a concern, which is how COVID-19 may impact the rates of suicide on a global level, national level, but also for healthcare providers, those that are on the front line, and just for general citizens that are out there. There's a lot going on which may lead to increased rates. It's brought on many new stressors, and it's removed many of our usual support resources that are out there. So as clinicians, as healthcare providers, as those that are on the front lines, we need to be learning more about suicide and suicide prevention techniques and being sure to really screen all of our patients for this risk. So what can be done for managing stress, for managing anxiety? The National Alliance on Mental Illness in April came out with some new COVID-19 information and resources. And they shared the following recommendations to manage your stress or anxiety. I also want to point out that I did include this link, a link to this resource on the final slide, because they have a lot of additional strategies and links that you can go to for more information. So the first thing, which I struggle with at the beginning of COVID-19, is managing how you consume information. So really, to start, be sure that you're getting information from reputable resources. Examples of these include the Centers for Disease Control or the World Health Organization. And then also be selective about how much news you're taking in. Watching or listening to the same news constantly can increase your stress. And talking from a personal standpoint, that's what was happening to me. I noticed I was listening to the same thing on the news every single day. So one of the suggestions they have here is reading, because reading can sometimes be an easier medium to control both how much and what kinds of information you're taking in. And then also make sure you're setting limits on how long you consume news information, including social media. Follow healthy daily routines as much as possible. Examples could be when you wake up in the morning, make your bed, get dressed, even if you're not leaving the house, get dressed, do what you would normally do if you were going off to work and leaving the house. Making time for breaks. I know right now, I am in the house most of the time, and I have my 3 children and my husband, and I need to take time for breaks to myself because we don't get that as easily as we have in the past. Practice good hygiene and really prioritize sleep. And then take good care of yourself with exercise and movement, really making time for movement in our daily lives. Many of us are less active than we were before because of the restrictions that are out there. So some ideas for moving could include just walking, stretching, dance, yoga, and then this resource provides a lot of other ideas as well. And then practice relaxing in the present moment. This is known as mindfulness, and this type of awareness can really reduce your stress. It includes focusing your attention on the present moment and accepting this present moment and how you're feeling without any judgment. Meditation is another useful way to relax and be in the present. And then do meaningful things with your free time. If you find yourself having free time, read a book, do tasks around the house, cook something new, learn some sort of new skill, and create art. I found myself during this time spending a little bit more time with my kids than I have in the past, and really taking that time to, when they're doing art, I create it with them and I sit down with them. And I think taking those moments can be really important. And then finally, what I feel is most important and really one of the biggest challenges right now is staying connected with others and maintaining our social networks. Physical distancing, also called social distancing, has really changed the way many of us interact with people that we care about. Early on, I tried to encourage my children with a quote, reach out with your hearts, not with your hands. So that, stay in touch, keep reaching out to people, even if we're not able to touch them and hug them, we can still reach out and stay connected. There's many ways you can, a phone call, a handwritten note, virtual meetings. You could even plan virtual activities together, arts and crafts, reading the same book, or playing games online. So final thoughts and reflection, as I mentioned at the beginning of this presentation, what I have provided is an overview. New data and research is emerging daily related to COVID-19 and those who are more vulnerable. As healthcare providers, as those who are on the front line, we need to be there to support our communities. I leave all my students with these 2 quotes, and I hope they translate well, and I want to share them here today. And the first one is from J.G. Whittier, and this was written in 1856. For all sad words of tongue or pen, the saddest are these, it might have been. And that's really reflecting back, I wish it had been this way. And then in 1871, Bret Hart said, if of all words of tongue and pen, the saddest are these, it might have been. More sad are these we daily see. It is, but hadn't ought to be. And I always encourage my students, I want to encourage everyone that you may only be one person, but really change starts with you and you can make a difference. I really appreciate you all taking the time to listen to my presentation. Keep learning, keep working with our vulnerable communities to improve their health outcomes. And these are my references. And I'll close with any questions that anyone might have, or however the format's going to go here, but I'm available for questions. And then there's my last slide with some additional resources. Thank you all.
Okay, thank you, Lindsay, for the very inspirative talk about how is the vulnerable communities facing during this COVID-19 pandemic. So before we are moving to the next speaker, I want to inform for all of you, all participants of this international webinar, if you all have questions for this presentations, you can write down in the chat room for both of you, for all participants who participating in the Zoom meeting or in the watchings in the YouTube live streams. So you all can also make ask questions, and please write down your name underscore your institutions underscore your country and underscore your questions. And in the end of this first panel discussions, after the second speakers will delivering the talks, we will open the questions and answer sessions. Okay. For the second speaker, and uh, I I would like to call the Miss Christina Eferencia. And Miss Christina Eferencia, she holds a Master of Science in Nursing Science from the University of Indonesia. Now she is working as a lecturer in the Institute of Health Sciences in Yatsi, Tangerang, Indonesia. In this time, she will present or delivering her talk about the impact of the COVID-19 pandemic for students and alumni. So, hello, Miss Christina. Hello. Are you there? Hello, I can hear your voice. Okay, hello. Hello, Christina.
Hello, Dr. Arif.
Yeah, hello, good morning.
Hello. Yeah, good morning. Can you hear my voice?
Yeah, I can hear you.
Okay.
Everything okay? You can share your PowerPoint and you can go ahead for your talk.
Okay. Okay. Thank you, Dr. Arif. So I can start with my presentation.
So please, whoever people in the behind of the Miss Christina, can you please be quiet because I hear a noise voice back on your
Okay.
video.
Noise. Yeah.
Okay. Can you please share your PowerPoint, Christina?
Okay.
Okay, time is yours. Go ahead.
Thank you, Dr. Arif. I will start my presentation. My presentation is it's about the impact of the COVID-19 pandemic on students and alumni. Yeah. Currently, the world is shocked by the epidemic caused by a virus called corona, or well known as COVID-19, coronavirus disease 19. The virus that originally from Wuhan, China, on December 2019. It is spreading all around the world. Due to its rapid spreading or transmission, many countries have been affected by this outbreak. So that the World Health Organization declared the outbreak of the spread of the coronavirus as a world pandemic. The COVID-19 is an infection disease caused by virus we already know as SARS-CoV-2 or coronavirus. Patients with COVID-19 can experience fever, dry cough, and difficulty breathing. In the most vulnerable sufferer, this disease can lead to pneumonia, multi-organ failure, and can eventually cause death. This pandemic has become a serious problem that must be faced by the world today, including Indonesia, that we must set up a policy, our government to set up a policy. So our government finally set restriction on community activities. One of the impact of pandemic is activities on schools, universities, and high schools. The government regulation is issue regulation and guidelines to break the chain of transmission. On we call is PMK number 9/2020 about PSBB. The government established the method of large-scale social restriction. It is the stand for PSBB. One important point from the 6 point from PSBB is school to be closed and workplace conducted from home for at least 14 days based on the incubation period of the COVID-19, which can then
Hello? Hello, Miss Christina? Are you still there?
Yes, I am. Following the government regulation, Stikes Yatsi that are on the province of Banten. So the government of provinces of Banten issue the regulation for PSBB too. The guidelines, and then the government issued the regulation about how you need education to the regulation for teaching and learning, and to use prevention to all the students after that government regulation for learning from home and work from home. Based on that, especially area, the content of the regulation is especially for area that already affected by COVID-19 and following condition apply.
Hello, hello, Christina. Okay, maybe due to the technical problems, um, because of the bad signal, or can you operator in the Stikes Yatsi, can you fix the problems, or we just jump to the question and answer sessions?
Due to that decision, the learning method instantly turned into virtual or online. What is the experience, the student experience of this situation, these decisions? They feel shocked regarding the new system, confused. Students might think about how to learn. They are stressed because their planning is delayed. How is the learning process that will be taken? The costs that incurred, their health, their fear of contracting. There is a change of learning classes from class on campus to its home with all the limitation they have. For example, not yet technologically literate. Their exam using the online method. How does COVID-19 affect study? There are a positive impact, negative impact, and there will be a paradigm change after these times go on for the future. There is four point impact the students. The students undergo online learning method study and do assessment from home. Field practice has stopped. Laboratory practice, practicum stops. Scientific paper, essay, or thesis is disrupted. Research cannot be done. And for alumni, graduations cannot be done. And some maybe do online. New graduates cannot get the job. But the advances of these situations is the method include that people involved, HR students must be technically literate, so they learn to do this and they will be technically literate. Students problem, they must have enough data packets on her or his phone to be able to access the lecture. And that's the home, the rent house or boarding atmosphere calm enough for learning, because the disruption can come from family members or once rented friends or boarding house. The disruption that comes also come from themselves. The habit of playing games or social media must be controlled by students themselves in order to be focused. The positive impact is there is awareness of students to study with an independent systems. They must do this to solve the problem. Students can get material easily and learn to evaluate their own learning. For students with experience, the problem of the experienced student at this moment, students continue to struggle most significantly with time management and balancing family, household, and school responsibilities. They must adjusting to online instruction and finding quiet place to learn, sometimes difficult. So the positive impact for them, they must learn more in time management and they can choose a suitable place for learning. For field practice, that cannot be done, so we wait. Laboratorium practicum, field practice can be done. Scientific paper, essay, thesis, and research. Scientific paper, essay, or thesis is interrupted. Consultation and discussions will superior can not be done face-to-face due to stay at home. Cannot do research because it does not get permission from the research sites. The fear of the people that they are also reluctant to go to the hospital or health centers. We know there is a decreased number of patients go to hospitals. More than half percent of patients don't go to hospitals in this situation because they are afraid of get transmission of COVID-19. So the students must change the method. Another problem is difficult to access book or a source reading that support the scientific paper, essays, or thesis. Students themselves must obey government rules at home. These focus students to have this problem force the students to have virtual consultations.
Hello, Christina, are you done with your talk?
For
Okay, thank you very much for your talk, Christina. We are moving to the Q&A sessions because we all lost your voice. So I think it would be better if we move to another sessions because we are still in the running out of times. So for the question and answer, please all participants, if you have questions, you can write down in the chat and I can deliver to the speakers. So we have 3 questions. The first one is from Anita. Anita is from Central Java, Indonesia. She want to ask for Lindsay about in the America, one of the vulnerable communities are children's. How to organize and to control their anxiety according this COVID and to make them understand to stay at home. Hello, Lindsay. Can you hear?
Hello, I can hear you.
Yeah.
I think children are a big challenge. I know there are many resources out there to for children to gain a better understanding of what is needed in terms of social distancing. Um, I know it's been a challenge for my own children. I think one of the most important things is for parents to be able to speak to their children, to speak frankly and honestly about what's going on. And then to also just make it clear that there's other ways for them to maybe connect with their friends. So I think it's just a challenge. Each individual family is going to have their own thing that's going to work best, but I think being open and honest and sharing with children why we're doing what we're doing is the best thing you can do. Good hand washing, good hygiene. I don't have much beyond that. I know there's a lot of great resources out there. I know in the United States, there's been a few different videos that have come out from popular media trying to educate children on the importance of social distancing. I've seen it from Sesame Street. I've seen it from, I think Nickelodeon is one of our big networks. I've seen commercials on there where they're trying to let kids know how much 6 feet is by sharing common things that they might see in their daily life that indicate 6 feet. So.
Okay. How's the currently situations in the America? Is there school children's already open or still in the quarantine?
Yep. So schools are still closed. We're still quarantined. In the state of each state is different, which is one of the challenges here in the United States. Every state is a little bit different. I'm in New Hampshire, and our stay-at-home order has just been issued up until June 15th. It seems to be changing about every 2 weeks, so I don't know if that will be extended even longer. And I know our schools are still exploring what's going to happen in the fall. So for school-age children, they're still not sure whether we're going to be going back elementary age, whether it's going to be some sort of hybrid format where they might have half the kids come some days, half the kids come other days, and still some virtual learning. And then also with college-based learning, the same situation with these, whether or not campuses are going to open up, I think it's still up in the air. A lot of universities have not made the final decision about what our fall semester is going to look like. And for fall, that's September for us. So.
Okay, yeah. We are now living in the uncertainty, right?
Yes, all uncertainty. Yes,
And the
that's for
question
sure.
is, for how long we can live with this kind of a new normal, I think.
I know.
Okay, next questions. We have a question from the Maura Haryanti. It's from Yogyakarta. The question is, in your experience, how to manage or organize relaxation and being present in the moment due to the situations and conditions? Because so many people, especially students in my country here, always said that they have so many activity regarding during the work from home or learning from home, how to support them for doing this important case in order to reduce vulnerable situations, especially for their life in this country.
And I can't speak specifically to your country, but I can speak to what I think is useful. And one thing that I have done and that I've heard a lot of other people doing is just making sure that you schedule time in your life to do that. So whether you put it on your daily calendar, I'm going to spend 20 minutes at this time, I'm going to go for a walk. If it's, if you have the ability to go outside, I'm going to sit down and I'm going to meditate, or I'm going to stretch, I'm going to read a good book. Just like you would schedule your time to do your homework or your assignments or anything else you do in your daily life, make sure that you're making that time for your self-care as well. And during this time, self-care is it's so important. And so I think that's the best thing that you can do. Just make sure that you're scheduling it and you're sticking to that schedule. Because even though it might seem like I have so much to do at this moment, I can't just sit down and relax. If you make that time to do it, everything else is going to be there when you're done. But then you're still taking that time to yourself. Thank you. That was a great question.
Okay. The last questions. It is maybe relate with us. That we are working in the academia and working in the university or or anything else. For the vocation study, you know, the vocation study, it is an obligatory to do intern during this term of the study. However, with the pandemic situation, it cannot be done. How should we do overcome the problem? Because will that be okay with the potential users in the future? Because yeah, we cannot do so many things that related with our study.
Well, that's a big challenge. Is that question for me or for the other speaker? I know one of my colleagues later is going to be sort of touching on some of those challenges we're having in the U.S. with clinicals.
Yeah.
But I know that in our we do not teach in a vocational setting at Southern New Hampshire University. It is a post-licensure program. So in our BSN program, the clinical experiences are limited, and we are able to create some sort of virtual alternative where they're still assessing a population and creating a health education activity for that population. But I think one of my colleagues may be able to speak more on that later.
Okay, so we have to make some compromise with this current situation.
Absolutely.
Otherwise we cannot do anything. All right.
Absolutely.
So, okay, Christina, can you answer the question as well? Because it's related with the vocational study in the Institute of Health Science in Yatsi, Tangerang.
In these situations, our school still closed. So we will start with online for the course. For the course, we will start for the second semester with online until the regulation from government maybe to be more not so limitation. The limitation is longer than before, so maybe we'll be back to school again, but with some regulations. The government issue the semester will be longest for 1 semester. This is in regulation. It is based on the faculties, universities, high schools to make an
Yeah. Hello, Christina, are you still there? Okay. Thank you very much for your explanations, Christina. And I think we are finished of these discussions, the question and answer sessions. And once again, thank you very much for Lindsay and Christina for your time and your very, very insightful explanations for us. And 2 remarks to closing this first panel discussions. Ladies and gentlemen, finally we come to the end on the part of our first panel of discussion. May I assume that some important points from these fruitful discussions that we had. If we do the right things and do what we know works, we are able to maintain social distancing and facial coverings and making sure our most vulnerable members of the population are protected. We may be able to respond and reopen safely, and we might just get through of this pandemic outbreaks. So we would like to say thank you again for the presenter and for the informative and interesting talk, and to audience for the participation in these sessions. Don't go anywhere because we still have another sessions in the second and the third sessions in these seminars. I am Adi Saptaji as a moderator in the first discussions. Thank you for your attentions and bye bye. Thank you, Lindsay. Thank you, Christina.
Thank you very much.
Yep. Okay, so I give it back. I give back to MC. Hello, Leah. Can you take over? Hello, Leah. So, okay, we are moving to the second discussions. So please, Zahra, can you take over to lead these discussions?
Okay, hello. Thank you for all of participants for the webinar session 1. Now we move to the webinar session 2 with the title is Health Education and Technology During COVID-19 that will be led by Mrs. Zahra. Mrs. Zahra, can you hear me? Hello, Mrs. Zahra. Okay, all participants can wait for Mrs. Zahra, right?
Okay, here.
Okay, Mrs. Zahra. Okay, Mrs. Zahra with the account with Ida Farida, right?
Yeah, I'm sorry. This connected is unstable here.
Okay, have a trouble. Okay, Mrs. Mrs. Zahra. Now, this is time is yours. Okay, please with the webinar session 2.
Okay. Okay, thank you very much to Mr. Arif and Ms. Lia for the opportunity for me. And Assalamualaikum warahmatullahi wabarakatuh. Good afternoon and good evening for all participants and for the speakers. Can everyone hear me clearly? Okay. I hope everyone hear me clearly because over here the connection is unstable. I'm sorry. Okay, if you any problem participating in the webinar, you can communicate it in the chat box. Okay, before the presentation begins, I want to remind to all participants, if you like to talk, you can share question in the Zoom chat box question and answer with the format, your name speakers, and your question. Silahkan Anda bisa mengajukan melalui chat inbox kita, kemudian nanti Anda sebutkan nama, kemudian ditujukan untuk siapa dan pertanyaannya mungkin apa dengan jelas dan yang pastinya dengan berbahasa Inggris. Kemudian nanti Anda bisa mungkin raise your hand-nya kita lihat di chat box saja ya. Okay, and we share material webinar today and the certificate in website Stikes Yatsi you can download after the webinar. Okay, well, ladies and gentlemen, before this presentation begins, let me introduce myself. My name is Zahra Maulidia Septimar. I'm lecturer medical surgical nursing in Stikes Yatsi Tangerang, and I can be called Zahra, and I will be serving moderator today. Okay, first of all, I would like to thank two speakers. Very pleased to see you here and welcome all of you participants in the international webinar and all audience. Thank you for joining in the webinar. Okay, ladies and gentlemen, for the second session, we have two amazing speakers and we share and discussion about health education and technology during COVID-19. Okay, the first speaker is Dr. Tony Clayton. Hi, Dr. Tony. Are you there? Dr. Tony?
Yes, hi, I'm here.
Hi.
Thank you so much.
Okay, good evening.
Really happy for the invitation. Thank you so much.
Okay, how are you today?
I'm wonderful. I'm
Okay.
really excited. I see we have about 700 participants.
Wow.
I know.
Okay, and we have a speaker, Dr. Stacy Rosenberg. Good evening, Mrs. Stacy. Are you there, Mrs. Stacy?
She's here.
Hello, I was trying to get off mute.
Okay, good evening.
Good evening and good morning to you.
Okay, how are you today?
Very good, and I'm very happy to be here, and we just went over 700, so
okay.
more people are joining. It's very exciting.
Okay. Okay, before the presentation begins, let's know the regulation, how the presentation will going on. Firstly, this presentation will be held with a panel discussion, right? So later the first speaker will talk and thereafter finishing continue with the second speaker. And the end there will be question and answer session. And like to give the time to each speaker to present the material for about 20 minutes, right? Okay, is it clear to Mr. Tony and Mrs. Stacy? Okay.
Yes.
Okay. Okay. And we'll be start. Okay. Yeah. Okay. We'll start with the first speaker. First speaker is Dr. Tony Clayton. We'll start with Dr. Tony Clayton. She is one associate dean of health profession and serves as vice chair of the Global Campus Institutional Review Board of Southern New Hampshire University, the United States. She obtained her Bachelor of Science from Indiana University, MBA from Indiana Wesleyan University, and PhD from Capella University. Dr. Clayton presented her work on experiential learning models at the International Conference on an advancement in health science education and profession held in Bangkok, Thailand. And the material to be conveyed today is about expanding telehealth is response to COVID-19. All right, let's go on the first speaker to share your presentation. How, Mrs. Tony, are you ready? Okay, to Mrs. Tony, we please you. Okay, Mrs. Tony.
Okay, can you see my? Uh-oh, you see my notes? Well, that's not good.
Okay. I hear you.
Okay, I did the, let me just give me a minute here.
Okay.
I am not sure why it's not presenting.
May I can help you?
Okay.
We are sharing on your sub-share in your material.
I do not know why.
Okay, we share for you.
Well, I kind of made some changes to mine.
Okay.
Let me just try one more time.
Okay.
When
We wait.
slideshow, do I just press beginning?
Okay. Okay. We wait.
I'll try one more time. Share.
Okay. Okay. Go ahead.
Okay.
Okay. Wow.
But you see my elephants?
Yeah.
Okay, so do I go from beginning?
Okay. Go ahead. Time is yours.
And you still see the right side?
Okay. The good picture.
Okay.
So Dr. Tony, you can use the display setting to set off your notes in the above display setting.
Display setting. Oh,
Oh
display
yeah.
setting.
Display setting. Oh, I'm sorry. I don't know.
Is that better?
Yeah.
Okay. Thank you, Mr. Arif.
Okay. Okay.
So you can see that screen.
Yeah.
Yep,
Okay.
it looks great.
That's great.
All right. So we're good?
Yeah.
Very
Yeah.
good.
All right. Wonderful. Thank you so much. And I appreciate your patience and good morning to everyone. So my presentation is going to talk about telehealth and the response to COVID-19. So telehealth technology, it's offered to our patients, it's offered by our providers, and it impacts our health insurers. So in the first photo, you'll see an example of video conferencing. We have a physician, he can have a face-to-face interaction with the patient. And this is one way that doctors and physicians have been able to respond to patients that cannot come into the office. Remote monitoring is when a patient is sent equipment that sends data electronically. So an example of remote monitoring is something that I actually use at home, and it's called an oximeter. I put that on my finger, and what it does is it measures my oxygen levels. And because of COVID-19, I might have symptoms, but they're not that obvious. But by using an oximeter, myself and other individuals that are checking this feature at home, it will let you know if your oxygen levels are low, and that will help you know to seek care. You'll also see in the bottom, you'll see a blood pressure, you'll see a little machine. And when we talk about wireless communication or electronic communications, there's a lot of patients that for a numerous amount of illnesses and care that they have at home, that they're able to check, so they don't have to leave their home, and several times a day, they can connect to a device, and then that information is going to go electronically to the physician office. So telehealth on the far right can occur in what we call rural locations, because a lot of our hospitals are in very small communities, and it would take patients sometimes several hours to get to one of the larger hospitals. So on the far right photo, you see the patient's actually at a small hospital, but he's able to, through telehealth and telemedicine, connect to a doctor who's in one of the larger cities. I personally was able to have some experience with telehealth to have some checks on my heart before going in for a minor surgery. And I was able to, the physician was able to see all my vital signs. I was able to have a face-to-face conversation with them. He could actually see, the color of my skin and see, if I was pale or if I had, maybe a tint or, different things he could see through this option. And so what we know is in the United States, telehealth has in the past, it's been adopted somewhat by some of the hospitals and communities, but In the United States, we've been somewhat slow to adopt that across all health facilities. One of the reasons is the cost of equipment and also because of implementation costs. And that's really deterred many hospitals and clinics. Then at the center of those decisions is the impact of reimbursement. So many times, doctor's office, hospitals, they're not really able to get reimbursed by insurance as much as if the patient came into the office and was seen in person. In a JD Power telehealth satisfaction study, they found that there were other hurdles such as a lack of awareness and also a lack of access. So the statistics that you see listed here on this slide capture the United States roughly a year ago. So July 2019, right before we went into the fall, before COVID hit the United States, about 74% of Americans they weren't even aware that telehealth existed or that there were options for that. And then telehealth services also were not covered by many of the health insurance providers. So about 40% of Americans, if this was an only option for them to receive services and healthcare, they wouldn't even be able to try for this because the cost would just be too much. And then, as I mentioned earlier about the rural areas out in the country, farther away from the city, about 72% of those Americans also lack availability and awareness as well. Now, the JD Power telehealth satisfaction study, and I do have that in my references, but they actually created an actual telehealth satisfaction index model, and they designed it with 15 quantifying performance metrics. And so that model will be helpful as we continue through the months and then continue to the end of the year and survey, and we'll be able to really get some good data to continue evaluating the impact of telehealth. Telehealth, some of the considerations that many of the organizations when COVID-19 really first in the United States, many people really started to become aware in the middle of January. And by the end of January, we started to hear more about China, more about what was happening in Italy, and then increasingly became healthcare administrators and physician offices increasingly started thinking about telehealth and starting to think about what they might be able to plan for. And what they saw is a plan that included looking at the geographic restrictions, which those could be rural or non-rural locations. They started thinking about the qualifying originating sites, and then those would be where providers are allowed to provide services in a patient's home. And then a qualifying distance sites are where qualified professionals can actually work from home, but provide those services to patients. The covered telehealth codes, those were codes reimbursement could be used for screening and treatment. And then licensing started to be a consideration. So our Centers for Medicare Services, in response to COVID, they've temporarily waived some of the requirements on some of the licensing, and they have allowed physicians to do some of that telehealth services for remotely for the rural and non-rural locations. And now I noticed that in one of the earlier presentations, it was interesting that they included some of the steps that your government took and some of the legislation, some of the changes that were put into place to help address COVID-19. So what I have on this slide is our government response. So on March 6th, Congress passed the Coronavirus Supplemental Appropriations Act. And in that act, it included about 500 million of an authorization to enhance telehealth services. And this legislation gave our U.S. Department of Health and Human Services the authority to waive and modify certain telehealth requirements. Because in the past, there were quite a few restrictions to using telehealth. And when Americans could no longer leave their homes and many of the offices were shut down, there had to be an option for them to get medical care. So this was really important. And so once the president declared a national emergency for us on March 13th, then this act was able to be initiated by the Human and Health Services Secretary so that they declared a public health emergency. Now, March 17th, the Centers for Medicare and Medicaid, which is one of our biggest providers, and is particularly for our elderly populations, they released some guidance and some extra clarification to really what those regulations meant. And then the CARES Act also was implemented towards the end of March, and that also expanded some of the information and the access and provided what we could and couldn't do. Hospitals and healthcare, they're under HIPAA regulation, so there's always some guidelines that they're following, and this COVID-19 really pushed them to think outside of the box. And then we also have by April 2nd, we had the Federal Communication Commission approved a COVID-19 telehealth program. And then what that did was it helped give funds for healthcare providers so that they could actually purchase telecommunication services, because one of the hindrances to having telehealth is the high cost, the cost of equipment, the cost of training. They also provided funds so that, just like even when we're trying to meet in this webinar, having that internet service, that connectivity, that ability to be able to connect to the internet so that you can utilize the telehealth equipment is really critical and was very much needed in response to COVID-19. And then they removed the cost barrier of the adoption for the smaller physician practices, because in the past, remote and telehealth visits were not paid as high, and physicians weren't reimbursed as much when they saw patients, but they removed that barrier. So physicians could see patients via telehealth and not be penalized financially. So when we think about the telehealth expansion, so in a previous slide, I mentioned a little bit about where we were in July of 2019. So quickly, we increased by 50% in the amount of telehealth visits. And for the year 2020, we're expected to be on pace to exceed 1 billion virtual healthcare interactions. And we do know that our tech giants like Apple and Google are busy working to ensure that we can provide that technology, that broadband, that bandwidth, so that we can access that for our patients. Now, some of the support I've already mentioned, but some of it I'll recap here, but the government reduced the cost barriers. They eased the regulations, and then they also allowed the use of mobile devices, because up until COVID-19, the use of your iPhone and other iPads and other devices were not readily used. And in part, that's because of the safety concerns as well. But they really felt like they had very limited options and really needed to ease those regulations. And then finally, supports for virtual visits included waivers that permit physicians to treat new and current patients using telemedicine. And it's important to note that we really aren't sure how long some of these government options will remain, but we are estimating, and the data that we're hearing reported is expecting that we could get a resurge in COVID-19 cases in early fall and into the winter months. Now, some of our adjunct instructors at Southern New Hampshire University work in hospitals and clinics and for departments of health, and they have provided a few stories for us about their experiences, which pretty much stem from the week of March 9th through the 13th, which is when the federal government declared the COVID shutdown. Now, on the left-hand side are a few quotes, but one of our faculty members, Scott Andridge, he's a vice president, chief financial officer for a medium-sized, about a 356-bed hospital in the state of Indiana. And one of the things that they had a few services that they used telehealth, but they didn't have it quite expanded where they would have liked it to be. And when you think about all the departments in a hospital, you can see here, he had members from the quality assurance department, revenue, finance, IT, and many other support staff. And they had to work together despite the fact that many of those workers were sent home and told that they had to work from home, that they couldn't work in the hospital setting unless it was COVID-19 related. All of the routine procedures were put on pause. So if you had a hip or knee implant scheduled or another routine that wasn't life-threatening, those were canceled and or postponed. So the hospitals were only seeing individuals that were COVID-19 related or some other, if it was an emergency from a car accident, they would still be seen. But hospitals were working to make sure that they separated parts of the hospital where only COVID-19 patients would go, and then the other opposite wing side for other cases. Scott also talked about just that coordination and changed that services that really needed to be communicated to the clinical staff as well as the non-clinical. Now, one of our other adjuncts who he teaches one of our healthcare administration capstone courses, and he also teaches one of the courses that we offer on global health, and that's Dr. Matt Fredrickson England. And he is a chief compliance officer at Wyoming Medical Center, and that is Wyoming is one of the states that's located a little more towards the west in the United States. But he had to quickly spend time educating his staff on some of those billing regulations that I talked about on the previous slide, those changes that the government, the CARES Act, he had to quickly read through those, and his staff had to try to figure out how were they going to implement that and then bill for that. He implemented some new telehealth options and then tele-ICU services. And the tele-ICU services were systems where they could connect to the larger hospitals, they could connect to physicians. And it was really critical too, that a lot of the cases that came into the United States came in on the West Coast through the state of Washington, and then the other cases came through Europe to New York City. And those cases seem to have a little bit of different symptoms, but what you had is physicians communicating through telehealth from numerous locations across the United States, comparing information, comparing treatments, and trying to learn from each other in a very small time frame to be able to take care of the patients they were seeing. And Dr. Fredrickson, England, he also had to work to keep the physicians, nurses, because even though you're trying to rapidly communicate and take care of patients, there's still HIPAA privacy laws. So sharing patient data, patient information, personal information about patients, that also had to be carefully communicated and figured out how they would best handle that. And then I know that many of us have heard about the ventilators and then the shortage of ventilators. If you've heard the news in the United States, that was a really large issue for hospitals, because that's an expensive piece of equipment, but it's not something that hospitals have to keep a lot of them, in stock. Most hospitals have a pandemic supply in their inventory that they always have ready and prepared for any kind of a large event, or in the community, if there's a plane crash or some large event that they would require and need some emergency supplies. But most hospitals in the United States have some kind of pandemic inventory that is just reserved for the event of a pandemic, which we've seen. So that ventilator allocation plan had to be put in place really quickly, because they had to decide, okay, how many do we have? How many patients might we have? How are we going to, treat our patients? So it was quite, it was how this benefit to our students is that with our adjunct instructors, and there were so many in the healthcare and in Stacy's program nursing and in Lindsay's area of public health, so many of our instructors were working in the front lines to address COVID-19. So sharing what they learned with our students has been really valuable.
Okay, Dr. Tony, I'm sorry, your time is time's up.
Okay, this is my last slide.
Okay, go
Can
ahead.
I have 1 minute?
Okay.
Yes, okay. So I'll wrap it up. Give me one minute. Okay. And basically the telehealth and the patient experience is where we're moving forward. We're going to talk about the patient experience, hospitals, staff, educators. We're all looking at the patient experience, safety, how are we going to keep the records confidential, the risks. You can see I have those listed at the bottom, how are we going to prevent cyber attacks, privacy, liabilities, and then my slides. And then finally, I just end with questions. And you may recognize, this was from the Thailand conference. I wanted to throw in a picture there of some of our new friends from Indonesia that we were really happy to meet. And I'm done. Thank you.
Okay, thank you very much, Dr. Chani. I'm sorry to her time's up. Incredible telehealth technology in the United States, right? Yeah. I hope the government in Indonesia can also expanding telehealth COVID-19 is United States. Because telehealth technology offer benefit for patient, provided, and insurance. Thank you very much to Dr. Chani for giving such informative, interesting presentation. Okay, we continue with the second speakers. She is Dr. Stacy Rosenberg. Okay, she is one of Associate Dean of Nursing and Health Profession at Southern New Hampshire University, the United States. She has a certified nurse educator. And you know what? She over 20 years in higher education. Wow, okay. And the material to be conveyed today is about nursing or midwifery education during COVID-19. Okay, all right, let's go on the second speaker to share your presentation. How, Mrs. Stacy, are you ready?
I am.
Okay, to Mrs. Stacy, we please you. For the material, your share? Okay.
Can you see it?
Yeah.
All right. All right. So, as mentioned, my name is Dr. Stacy Rosenberg, and I'm going to be talking about nursing and midwifery education in the United States during COVID-19. We will just go over an overview. We'll talk about accreditation, licensure, and offer some resources that I've found to be very helpful. In regard to COVID-19 in the United States, three main things are occurring. Our clinical or healthcare facilities are limiting or refusing clinical experiences. The nursing and midwifery programs are needing to be creative to find ways to still meet student needs. And our regulatory bodies have implemented changes to facilitate clinical experiences during these trying times. I'm including a slide here of where I live, which is Minnesota. It's in the red. It's on the northern part of the United States, adjacent to Canada, just to give you an idea of where I'm at. Lindsay, who spoke earlier, she's in New Hampshire, so she's on the eastern coast. And then Tony, who just spoke, she's in the middle between myself and Lindsay. So we all work at the same school, but we live across the country. In the United States, each state board of nursing is different and has different state requirements. In my home state of Minnesota, we typically follow the standard ratio of 1 clinical hour to 1 hour of simulation. And that stems from the National Simulation Study from 2014. But given the COVID situation, Minnesota has said that we need to be flexible and that nursing programs may be able to use a ratio of 1 to 2, so 1 clinical hour to 2 of simulation. So basically, they said, just make sure the students are competent. Make sure that they have the skills necessary to provide a high-level standard of care. No specific hours are required from the state of Minnesota. Next up, we're talking about accreditation and what that looks like. As you may know, accreditation is a review process that evaluates nursing programs. And it's based on best practices. It's an attempt to establish quality standards and make sure that students are receiving the right education. Our school, Southern New Hampshire University, is accredited by the Commission of Collegiate Nursing Education, or we call it CCNE. And that's just one of the accrediting bodies available in the United States. But CCNE says that we need to remain in compliance with their standards, but these standards allow for innovation, flexibility, and changes in program delivery in keeping with those accreditation values. Many schools are concerned about how the contingency plans of how we're going to address these difficulties that we're facing will affect their accreditation. But CCNE does not dictate how your didactic coursework is provided. So the delivery method isn't determined by them. So again, they're flexible. So for programs that weren't already online, they can go online and still be meeting the terms of accreditation. CCNE also says that clinical practice experiences must be embedded in their nursing programs that they accredit. They don't say how many, unless you're dealing with a nurse practitioner program or a doctor of nursing practice program. If you're in a nurse practitioner program, you have to have a minimum of 500 hours completed in the clinical setting that are direct patient care hours. And for the DNP, it's a minimum of 1,000 hours. But this hourly requirement for these two program types are over the course of the entire program, and they won't be waived even during this COVID situation. So, but the students still have their entire program to acquire those hours. So basically, this accrediting body is saying we need to be flexible about the number of hours and the types of experiences that we're offering. And experiences and things that are occurring in nursing education of flexibility and innovation are for students transitioning to online classes. Some of those students may not have access to internet, and there's schools that are providing parking lots where you go to get your internet. So they can't go into the school because of the shutdown, but they can continue their coursework. And that's been a change for a lot of people, and you may have encountered that too. The transition to online or remote learning, whereas our school already was an online institution, so we didn't have that much of a learning curve there. Other examples of flexibility or in innovation would be the use of virtual simulations and case studies. One of the pre-licensure programs that we are partners with uses some case studies where you can complete it virtually in a simulation setting, and those were offered free just from the people who produce them during this time, so that they're providing their service for free. And lastly, this is unique to our school, but we've been using an online experiential learning model where learners and employers meet to solve real-world problems online and asynchronously. So they're not meeting at the same time, but they're still getting the requirements done of a practicum. Now, the next slide is another accreditation body, and this is just for midwifery. It's the Accreditation Commission for Midwifery Education, or ACME. And just like CCNE, they don't specify hours, but they do want the students to demonstrate competence. And a big piece of midwifery education is teaching and counseling. And so, as Tony mentioned, telehealth is on the rise. These midwifery students can still use clinical hours by participating in these telehealth visits. And they can have a huge impact for those students and help them to develop a lot of confidence in those areas. And in terms of becoming an RN in the United States, following a graduation from a pre-licensure program or an entry-level nursing program, the students must take an exam called the National Council Licensure Exam, and it's called NCLEX. And changes have been made during this time of COVID to allow for social distancing, but still meet the needs of preparing new nurses to be able to go out into the field. So beginning in March of 2020 and lasting through September of 2020, the changes that have been made to the test include the number of test items has gone from 75 to 60 for a minimum level of passing. The maximum number that you can take is 130, and that used to be 265. And finally, it used to take up to 6 hours to complete this test, but now you're given 4. So some of the things have changed within the test, but the difficulty in the passing standards have not changed. And this is just a temporary measure to ensure that those students can get out there and begin practicing, but still maintain social distancing. And the next few slides are just on resources that are available to nurse educators and to students that are nursing and midwife students. The American Association of Colleges of Nursing has a specific webpage for coronavirus resources, and I've included that link in the reference pages. But this information is supporting school deans, faculty, students, and other stakeholders, and it highlights key information and resources needed during coronavirus disease 2019. And then for the midwifery students and practicing midwives, there's the American College of Nurse Midwives, ACNM. And this website provides webinars, general guidance on what's happening and what you'll see in clinical practice, and guidance for healthcare institutions and clinical practice sites. And again, this link is in my references. So throughout the presentation, you've heard the need for flexibility and innovation, but all of the different regulatory bodies are pretty consistent in their not being specific about the number of hours, but ensuring that we maintain competence of our students. So at this time, I'll close and we'll open it up for any questions you may have. Thank you very much.
Okay, thank you very much to Mrs. Stacy for your presentation. Okay, during the COVID-19, I think the learning practical health facilities was hampered in Indonesia, and the student doesn't demonstrate competence in nursing or midwifery, Stacy. How in your faculty or your country for nursing or midwifery faculty, with case study there is enough or any demonstrate in your faculty in nursing and midwifery for practical learning, Stacy?
I'm sorry, the question was
practical for nursing and midwifery, because psychomotor, right? For the nursing and midwifery, not just case study.
For the clinical pieces?
Yeah.
So the facilities are closed to students or very limited. So a lot of the students who are able to participate in clinical are helping with COVID type screenings or checking them in. Okay. So they're not doing the traditional clinical settings.
It's the same in Indonesia too. Okay, thank you very much to Mrs. Stacy for giving such informative and interesting presentation. Okay, ladies and gentlemen, now we come to question and answer session. I like to have 3 questions for the participant. Okay, I will read it. I have already had a question here. The first question from Yuanita Ani Susilawati from Stikes Santo Boromeus. This question addressed for Tony. Okay, the question she is asking about for people who live in rural area, what kind of government have done for them according to lack of awareness of telehealth? Okay, how Miss Tony, is this question clear?
Hi, yeah.
Are you ready to answer?
Yes. Yep. Thank you for that question. Yeah, so I think some of those government regulations that I mentioned, they are helping those individuals that live in rural communities. Actually, those that have insurance are able to get assistance and they're able to get help. So, for example, if somebody just didn't have internet connection, or they didn't have an ability to have even a computer or an iPod, some means to be able to have access. Insurance plans are offering equipment, offering some of those options for those patients. And then a lot of the communities, the community hospitals are working to also outreach patients, because some of them can, order, drop off at home. But it is a challenge still, though, because not all, I saw one of the other questions, because not all of the cases can use telehealth. There's going to still be times where patients are going to have to go to an emergency room because of what they have wrong. Just, I mean, it cannot be fixed, just having that conversation on telehealth.
Okay, okay. Thank you for Tony. So very interesting for you answer and explain. Okay, for Yuanita, right tadi ya, Yuanita ya tadi ya. Okay, this is Yuanita. I hope you are satisfied with the answer. And the second question from En Hernawati. It's not with the hospital. I work at the hospital. My question from Tony. Okay, can all the cash from the hospital be done using telehealth? How about an emergency case? And how to anticipate ordinary people who do not understand technology? Okay.
Yeah, I think both of those are considerations. First of all, some cases our patients do have to go to the emergency room for, they just can't be treated. But now when they go, their temperature is checked. So they're checked for COVID when they go, and their masks are required. And then your other question, it is our disparity populations, understanding, and then having the different languages. We have some communities where Spanish, so English, Spanish, and it is a challenge to try to get that education and communication out. So it can be done through a variety of ways, flyers, information at the health departments, information. But with so many having to stay home, it's been a challenge.
Okay. Okay, Ms. En, I hope you're satisfied for the answer from Tony. Okay, the last question, right? I'm sorry because I'm just have 3 questions. And the last question from Dwi Aryani from Stikes Yatsi, Tangerang. This question addressed for Stacy. Okay, she asking about how different about case ratio of COVID-19 in country, especially United States in Indonesia. Okay, Stacy, is the question clear? Are you ready to answer?
I am ready, but can you repeat it one more time?
Okay. How different about a case ratio of COVID-19 in United States, especially in United States? Just the question is it case ratio of COVID-19 in United States? Do you know?
Are you wanting the numbers? Are you wanting the statistics? Are you wanting the numbers of cases in the United States?
Yeah.
Okay.
So
go ahead.
I have so as of May 28th, the total cases reported by the CDC is over 1.7 million. And on that day, we also went over 102,000 deaths.
Wow. Okay.
Yeah, it's high.
Okay.
And
It's the
still
same for,
climbing.
yeah, in Indonesia, it's the same for case ratio of COVID-19, but I don't know this for case ratio of COVID-19 in Indonesia. Okay, Dwi Aryani, I hope you satisfied for the answer. Okay, ladies and gentlemen, we finally come to the end part of question and answer session. We really apologize to all participants for the question and answer because we have a lot of question, but we have limited time in this webinar, and you can question again in third session, because I'm the limited time in this webinar. Okay, before I close the webinar, I would like to take the conclusion from what the speaker have presented today. Telehealth during COVID-19 made treatment more accessible, and the government responded positively, and the implementing telehealth service was very challenging because for all staff incorrectly moved from working in the office to working at home. Support for virtual visits, such as the government reducing cost barriers for Medicare and patient currently using remote treatment. And for tertiary education, especially nursing and midwifery, it's also expected to have clinical practice experience, which will be provided in all programs, and the flexibility needed regarding hours and type of experience. Okay, the next agenda is giving a certificate to the speakers. Okay, to the first certificate to be given to Dr. Tony Clayton. Dr. Tony, I'm sorry, this is your e-certificate.
Oh,
Okay.
wonderful. Thank you so much.
Thank you very much for joining and sharing material this extraordinary today. Okay. And the second e-certificate will be given to Dr. Stacy Rosenberg. Okay, Dr.
Thank
Stacy,
you,
this is
Zara.
your e-certificate. Okay, thank you very much for joining and sharing material that is extraordinary today. Okay, now I would like make sure important announcement to all participants. We will send the material webinar and also the certificate to website Stikes Yatsi, and you can download this material and certificate, and also don't forget visit the record on the YouTube channel Stikes Yatsi Official, and don't forget to like, subscribe, and share. Okay, I'd like to thank so much the speaker for informative, interesting presentation, and to the participant for very active participation. Hopefully the webinar will be beneficial for everybody, and so we hope to you get something value knowledge, and we hope you still hardly. I mean, as a moderator, apologize if there are mistakes. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. Then I will give it to the third moderator, to Mrs. Rina Puspitasari, we please you. Thank you, Dr. Tony. Bye, Dr. Stacy.
Thank you so much.
Thank you, Mrs. Zara, for like the webinar session 2. Now we are moving to the webinar session 3. Thank you for the Dr. Stacy and Dr. Tony for the marvelous material. And then we are moved to the webinar session 3, right? The webinar session 3 with title is Nutrition and COVID-19 will be led by Mrs. Rina. Mrs. Rina, hello.
Yeah.
Okay. This is time is your. Please and thank you.
Yeah. Okay. Thank you, Mrs. Leah, for the giving time for me to continue the webinar today. Okay. Assalamualaikum warahmatullahi wabarakatuh. Okay. Good afternoon and good evening, ladies and gentlemen. Let me introduce myself. My name is Rina Puspitasari, and I'm as moderator in the third session of webinar today. Today we have, in the third session, we have three marvelous speakers. Yeah, marvelous speakers that in the expert in their field. The speaker will be delivered by Mrs. ST PhD. Are you there, Mrs. ST? Hello? Hello, Mrs. ST? Are you there? Hello? Mrs. ST, are you there? Can you hear me clearly? Hello. Okay. Maybe we can give a great greeting to the second speaker. Will be delivered by Dr. Aji. Good afternoon, Dr. Aji. Are you there? Hello, Dr. Aji.
Dr. Aji,
Hello,
are you
Dr.
there?
Aji. Are you there? Hello. Maybe the third speaker will be Mrs. Pritikhana from India. Good afternoon, Mrs. Pritikhana. Can you hear me? Hello, Mrs. ST, Dr. Aji, and Mrs. Pritikhana. Can you
Hi.
hear me clearly? Okay.
Yes, of course. Sorry,
Okay.
because
Hello.
the computer mute my voice.
Okay, okay.
Okay.
Okay, yeah. Okay, here the first speaker, yeah, Mrs. ST. Good afternoon, Mrs. ST.
Hi, good afternoon too.
Okay. And Dr. Aji, are you there?
Hi.
Okay, okay. You can hear me clearly?
Yep, correct.
Okay, good afternoon. And the third speaker, Mrs. Pritikhana, are you there? Mrs. Pritikhana? Okay, maybe still have a network error network or something like that. Okay, ladies and gentlemen, in this third session, we have a three panel presentation for about 15 minutes for each speakers, and then in the end of the presentation, we have a discussion session. Okay, let's start our panel presentation. Yeah. The first speaker or the first presentation will be delivered by Mrs. ST PhD. Theme nutritional recommendation in the time of SARS or COVID-19. Okay, before this is her curriculum vitae. Dr. ST Nurwanti is the Dean of the Faculty of Health Science, Alma University. Yeah, and Dr. ST presented her work at international conference in UK, US, Hong Kong, Thailand, and Malaysia. It's such a great curriculum vitae, I think. Okay, Mrs. ST, you have 15 minutes to show your presentation. Are you ready?
Yes, sure.
Okay, time is yours.
Okay. Okay, good afternoon, ladies and gentlemen. Today, I would like to present about the nutritional recommendation in the time of SARS-CoV-2 or COVID-19. Because now the outbreak of COVID-19 may be stressful for people because we are hearing and reading about the pandemic constantly without a break during quarantine can be stressful. We see every day that the number of new cases of the COVID-19 is increasing, especially in Indonesia or maybe in US is very stressful. So quarantine is associated with the work routine disruption, so which may lead to boredom. And as a result, the tension drive people to overeat and often to in search of comfort food. What is comfort food? Comfort food is simple preparation, but high calorie is, you can see in this figure, this is the high calorie food, carbohydrate, fat, salt, and sugar. And during the quarantine, also related to food craving, what is food craving? The desire to consume a particular form of food. So food craving is also related to emotional and intense desire to eat, behavioral, seeking food, cognitive thought about the food. And so almost every hour, maybe we think about the food, and also it's physiological salivation process. So, and then the prevalence of carbohydrate intake also craving among women is higher than men. So women have tend to have higher intake of carbohydrate than men. So it's also can affect the serotonin production and can affect the positive effect on mood, especially on women. So it means that during the COVID-19 quarantine, we have unhealthy nutritional habit that will increase the risk of developing obesity, that beyond our chronic state of inflammation, and also often complicated by heart disease, diabetes, and lung disease. So it means that if we have this kind of disease like diabetes and also heart disease, and then we will increase the risk for more serious complication for COVID-19. So quarantine-related stress also, so because we are stressed every day, like see the new cases of COVID-19, so it will lead to sleep disturbance. And sleep disturbance also will affect the higher food intake. So if we stress and then cannot sleep well, and then we eat more, something like that. So it is important to consume food containing or promoting the synthesis of serotonin and melatonin, especially at dinner. So what is the food that contains can or maybe can affect the serotonin and melatonin? Variety of plant that melatonin and also serotonin and also tryptophan, such as roots, leaves, fruits, seeds such as almond, banana. So when at the dinner, it's best that we will eat the this kind of fruit or almonds or banana or cherries or oats. And also we can also consume the protein food such as milk and milk products such as yogurt, because this is the main source of the sleep-inducing amino acid tryptophan. And tryptophan also can affect the regulation of satiety and calorie intake. So if we drink the yogurt and then we feel the satiety is good, so we don't have to have hungry, something like that. So if we easily to be hungry, and then it's good to consume yogurt, because yogurt also can inhibit the neuropeptide Y. So the neuropeptide Y is can increase our food intake. So yogurt also can increase the natural killer cell activity, and also it means that can reduce the risk of respiratory infection. And during quarantine, also the increased intake of macronutrient during quarantine is someone like you with obesity usually have increased the risk, the intake of macronutrient. But in the same time, the obese people also have the deficit of macronutrient. So this impair the between macronutrient and micronutrient also will lead to the impaired immune responses, because it will affect the cell-mediated immunity, phagocyte function, cytokine production, and antibody affinity. So it means that if we have like higher macronutrient and deficit micronutrient, so it's more susceptible for the viral infection. So we can easily to get the viral infection. So it means that we need to boost our immune function, and healthy and balanced nutritional patterns containing high amount of mineral, antioxidant, and vitamin is very important. And we know that fruits and vegetables is a source of macronutrients such as vitamin E, C, beta-carotene, is mean that antioxidant, because antioxidant can increase the number of T cell subset, enhance the lymphocyte response to mitogen, increase the interleukin-2 production, and potentiate natural killer activity, and also increase response to influenza virus vaccine compared to vaccine. So it is important to consume the food that contain antioxidant. So antioxidant abundant, or usually beta-carotene, is abundant in sweet potatoes, carrots, and also green leafy vegetables. And vitamin C we can find in red peppers, orange, strawberry, broccoli, mangoes. Vitamin E also we can find in nuts, or seed of spinach, or broccoli. So vitamin D also associated with immune function. Maybe Dr. Aji will explain more about the vitamin D. I will only present a brief of the vitamin D, because during quarantine we have like less time spent outdoor because we are afraid to go outdoor. We just stay at home. So it's mean that we have less sun exposure. So it's also associated with the reduced production of vitamin D as a result of lower level of 7-deoxyribonucleic in the skin. So it's especially in a country if now it's winter, vitamin D deficiency also increase. So it's mean also associated with viral epidemics because the function of vitamin D is to reduce the risk of cancer, cardiovascular disease, diabetes, and hypertension, and also can decrease the higher risk of death from respiratory tract infection. So the other function of vitamin D is related to COVID-19 is because vitamin D can protect respiratory tract, preserving tight junction and killing enveloviruses through induction of catalytic and defensive, and also decrease the production of pro-inflammatory cytokine by the innate immune system. So it means that vitamin D can reduce the risk of cytokine storm leading to the pneumonia when we get the infected by the COVID-19. So what is food containing vitamin D? We can find in fish, liver, egg yolk, and milk and yogurt with added vitamin D. Zinc also associated with the immune function. Previous study found that zinc inhibits severe acute respiratory syndrome or coronavirus RNA-dependent RNA polymerase, the template binding and organization in viro is 6 cells. We can find zinc in oyster, poultry, red meat, nuts, pumpkin seeds, sesame seed, beans, and lentils. So we just choose what kind of food that we are like it, and is the important thing the food is contain zinc. So during the quarantine also, people usually like tend to eat the Western diet, but Western diet have the associated with the immune function also, because Western diet usually high in saturated fatty acid. It will lead the chronic activation of the innate immune system and inhibit the adaptive immune system. Because previous study also found that high fat diet, so the previous study, they tried to give the high fat diet in mice, and they found that can increase the macrophage of infiltration to lung tissues, especially in the alveoli. So it is relevant to COVID-19 patient given the high rate of infection among lung alveolar epithelial cells and the involvement of lung tissue inflammation and alveolar damage in COVID-19 pathology. So T and B cell counts were also significantly lower in patients with severe COVID-19. So a potential interaction between Western diet consumption and COVID-19 is on adaptive immune impairment. So during the COVID-19, because we get the high exposure of COVID-19, so please be sure that the Western diet intake is lower. What kind of Western diet we can find, like potatoes, burger, or maybe salted chips, something like that. So, or pizza, or maybe it is the delicious food, but this is Western diet that high fat, high sugar, and high sodium or has high salt. So how about the nutrition and hydration for COVID-19? For patient recovering at home, because usually the COVID-19 patient have a fever, and fever associated with excess fluid loss and increased metabolism that can lead to the dehydration and increase the nutritional requirement. So if in the daily life before COVID-19, we only need 2 liters per day, but during COVID-19, or maybe we are already infected by COVID-19, we need 3 liters of fluid per day. So how to get to have the 3 liters per day, because it's too much. So we can drink like 2 to 4 ounces every 15 minutes. The optimal fluid is clear liquid, not sugar sweetened beverage, or maybe soda, or maybe the other like high sugar, something like that. So better fluid is clear liquid beverages, or maybe if they need it, because like some people with the infected with COVID-19 need the high calorie and high protein. So maybe we can choose also clear liquid with high calorie and protein, or maybe oral rehydration or sport drink. So how about the protein and calorie need for patient recovering at home? So the nutritional requirement is around 2,000 until 2,500 calories a day, and protein is around 75 to 100 grams a day. So how to consume high calorie and high protein diet? We can eat small amounts frequently, 6 times a day, every 2 to 3 hours, and we can choose the good protein sources such as peanuts, milks, eggs, yogurt, cheese, meat, something like that, and eat nutrient-dense food. And also drink fruit juice, milk, and other calorie-containing beverages, and double or triple the portion size of the added fats on oil or like butter, margarine, cream cheese, because we need the high calorie to fight the viruses, because we need the high calorie and high protein diet to also to increase our immune system. And an expert statement from an Aspen also like published this guidance for the nutrition management of individual with SARS-CoV-2 infection, because virus pandemic, it will lead to the double burden of malnutrition. So a future virus pandemic, because of COVID-19, we not only like increase the malnutrition, but also like will increase the overnutrition, because maybe like if people don't have money, so they cannot buy food. But if people like the rich people and don't have many task, or maybe just stay at home, so will increase the intake of food. So it's also lead to overnutrition. So after maybe the COVID-19 and double of malnutrition will appear, and also is also associated with severe of disease. Because if the people have obesity, like will increase one risk of being hospitalized with or dying from influenza virus infection, and also it can inhibit both virus specific CD8 and T-cell responses and antibodies response to the seasonal influenza vaccine. So the challenge for future virus pandemic, so protect those affected, not only people with undernutrition, but also with obesity. So the first, we should do like nutritional management individual at risk or infected with COVID-19. The first, that we should check for malnutrition, because patients at risk for the worst outcome and higher mortality if the people have malnutrition, not only undernutrition but also overnutrition. And also for older adult, is very also higher risk of higher mortality, and also polymorbid individual. What is polymorbid individual? That individual have two diseases such as diabetes or maybe coronary heart disease, should be checked using MUST criteria or for hospitalized patient. So the second is the optimize the nutritional status. So if the patient have malnutrition or obesity, we should optimize the nutritional status. And so the patient should undergo diet counseling for an experienced professional, and also should have the supplement with vitamin and minerals. So the subject with malnutrition ensure the supplementation with vitamin A, D, and other macronutrients. And also we should consider about the regular physical activity, because patients in quarantine should continue regular physical activity while taking precaution, and also oral nutrition supplement if needed, because ONS should be used whenever possible to meet the patient needs when dietary counseling and food fortification are not sufficient to increase the dietary intake. Because maybe like people is lazy to cook every day, every hour, so maybe we can choose the oral nutrition supplementation or ONS. Or maybe we can consider also enteral nutrition, because in patients whose nutritional requirement can be met orally, or enteral nutrition should be administered. So parenteral nutrition also should consider when the enteral nutrition is not indicated or sufficient. So how about the phenotypic and etiology criteria for the diagnosis of malnutrition? We can diagnose the malnutrition using the weight loss, percentage of weight loss. We should know like how about our body weight. So maybe our body weight is decreased more than 5% or more than 10% beyond 6 months, and or BMI, our body mass index, is less than 20, if our age is 70 years, or for Asian people, like if BMI is less than 18.5, or an age is less than 70, or maybe less than 20 if the age of more than 20 years. Or also reduce the muscle mass. We can see our muscle mass if our muscle mass reduce, so the malnutrition is increased. So how about the energy? For polymorbid patient,
excuse me, is this SD? Yeah, excuse me, 2 minutes left for you.
Okay, 2 minutes. Okay.
Yeah.
And we can also like consider about the energy for morbid patient is around 27 calorie, and severely underweight polymorbid patient is around 30 kilocalorie per kilogram body weight a day. So if our weight is 50, so we can just multiply by 30 kilocalories. So we can know our calorie need. And also protein is around 1 gram protein per kilogram body weight. So if our body weight is 50, so it means that we should have 50 gram of protein a day. And how about the ratio of fat and carbohydrate? If the people with no respiratory deficiency, the energy ratio from fat and carbohydrate is 30-70, and energy ratio from fat and carbohydrate if the patient with ventilator or ventilated patient is 50-50. So the conclusion is good nutrition is crucial for health, particularly in time when the immune system might need to fight back, and individual refrain from eating food high in saturated fat and our Western diet and sugar, and instead consume the high amount of fiber, whole grain, unsaturated fats, and antioxidant to boost our immune system. And we should also maintain the nutritional status and prevent or treating malnutrition, because it will reduce the complication and negative outcome in the patient at the nutritional risk who may incur in future COVID-19. And then the last thing is we should have the mind positive attitude, because it will help to tackle the negative health effect of quarantine. Okay, that's my presentation. Thank you for watching.
Okay, thank you, Mrs. ST, to a great presentation you're sharing to us. Okay, so the conclusion is it's very important to us to eat in healthy food. Am I right?
Yes, of course.
This is one of the to maintain the COVID-19. So we must eat unhealthy food. Yeah.
Yeah.
Okay. Okay. Thank you, Mrs. ST, for the great presentation. Okay. Well, to all the participants, let's continue to the second speaker. Yeah. Okay, Dr. Aji, are you ready? Yeah, you have.
Hello. Yeah.
Before you start the presentation, okay, I will read out the curriculum vitae of Dr. Aji. Okay, Doctor. Okay, Dr. Aji is a nutritionist and lecturer in University of Alma Ata, and he is also become a journal reviewer, chairman of Millennial Voice Indonesia, and a professional membership in Association of Nutrition of Indonesia and America Society. Yeah. Okay. Dr. Aji, you have 15 minutes to present your material. Time is yours.
Okay, may I share my screens?
Okay.
Okay, now I'm starting to share my screen. Okay. Okay. Can you see my screen right now?
Not yet. I cannot see the material you share. Okay, yeah. Okay. Okay.
Okay. Yep. Thank you very much for introducing me, Ms. Rina. Now I'm so happy that I have opportunity to share my experience about the vitamin D, because my latest research during my PhD is about vitamin D and human health. And this opportunity, we will talk about the vitamin D in the COVID-19 outbreak, the role in human immunity responses. So we will talk about the associations between vitamin D and also the immune response during the COVID-19 outbreaks. And yeah, I am a lecturer in the Department of Nutrition, University of Alma, and I also the founder of Azure Dietitians and director of Millennial Voice Indonesia, that one of the platform that focusing in the food security and nutritional science. So if we cannot catch up with this webinar, so I hope we can catch up in the outside of this webinar instead of this webinar in the social media or everything. Now, beginning in the what is the vitamin D? Vitamin D also known as a sunshine vitamins. Yeah, because what? Because the majority the vitamin D is come from the sunlight exposure. So, vitamin D is fat soluble vitamins like other vitamin A, vitamin E, and vitamin K. And its common function is in on bone mineral density metabolism, which help the body absorb the retain calcium and phosphorus. Interestingly, vitamin D is not just a vitamin. Why? Because the vitamin D is also a pro-hormone as well. Vitamin D is about nutrient what we eat and also a hormone in our bodies make that regulates our system endocrine effects. For the example is bone health, and the local cell regulations for the example is the modulations immune system. That is that we will discuss later on in the upcoming slides. And the classical action of vitamin D is maintenance of the homeostasis of calciums. And however, vitamin D has other non-classical actions or non-skeletal functions too. And before we jump in how to vitamin D related to immune response, regarding a SARS-CoV-19 or severe acute respiratory infections, this is how the vitamin D is made. We could get vitamin D from both a diet and also sunlight exposure, or synthesized by sunlight exposure. We have a multiple forms of vitamin D in our body. There are vitamin D2, vitamin D3, 25 hydroxy vitamin D, and also an active forms 1.25 dihydroxy vitamin D. This is the inactive form of vitamin D that also known as a calcitriol hormones. And in our body, those vitamin D2 and vitamin D3 will be converted to more active vitamin D form. There is of 25 hydroxy vitamin D. The form of 25 hydroxy vitamin D, it is what vitamin D commonly circulated in our body system before it turns into an active form for, we could say the vitamin D transform into calcitriol hormone. And this active form of vitamin D will function and taking part in on classical actions such as molecular regulations, immune modulation, and so on. And the importance of vitamin D is also vitamin D receptor. This receptor of vitamin D will work together with vitamin D. It will be such a binding of vitamin D and vitamin D receptor. And interestingly, vitamin D receptor have been found in so many of body organs and tissue have receptor for vitamin D. We all know the commons in the bone health because the commonly function of vitamin D is related to the bone health and bone mineral density. But vitamin D receptor also can be found in the um, brains, heart, immune cell, placenta, and also in the decidual cells. And these discussions, we will talk later about the immune cells and vitamin D associations. And this is the expanding of physiological role of vitamin D receptor and active form vitamin D binding. The vitamin D receptor and calcitriol will have a beneficial effect for the skeletal health as well, and also the calcium transport, central nervous system, skin and hair, and also the hormone secretions because it controlling or regulating the endocrine system in our body. And these systems, vitamin D and calcitriol, will work in the mediated through vitamin D receptor regulated transcriptions of genes that are involved in cell proliferations, differentiations, and also apoptosis. Now we will discuss about the vitamin D and the immune regulations. This graph or this picture presents that how the vitamin D and immune system relationship. The vitamin D receptor present in immunological cells, including B cells, T cells, and also macrophage dendritic cell. That it means that vitamin D receptor regulates the innate and adaptive immune system. Other non-skeletal functions also found in the upregulates immune system protein like catalysidine and defensins as a particle antimicrobial peptides and also as an antibacterial, antiviral, and antifungal properties. This is the how the vitamin D affect the macrophage dendritic cell in the enhancing of the catalysidine expressions and also improving the bacterial killing in our human body immune systems. And this review article that talking about the vitamin D supplementations could reduce the risk of the influenza and COVID-19. Um, Okay, vitamin D has been associated with increased susceptibility to infections like SARS, and also vitamin D has been associated with the lower risk of respiratory infections or lower the severity of the infections. We have already talked about the vitamin D. So what is the SARS-CoV-2? SARS-CoV-2 is the new beta coronavirus disease in the 2019. There are no vaccines and anything. We are in the developing of the research to find the vaccine to be suitable in this kind of virus. And regarding the article, we have the result of vitamin D randomized controlled trials on risk of influenza, because in this article they talk about how the effectively the vitamin D supplementation could reduce the risk of influenza and COVID-19. The review articles snapped in how the vitamin D affect immune systems, and this table present result from randomized control trial investigating how vitamin D supplementations affect the risk of influenza. It confirmed that the respiratory tract infection was indeed derived from influenza. Only two RCTs reported beneficial outcomes, one among the school children in Japan and the other among infants in China. To reduce risk of infections in this article, they talk about the recommended that people at risk influenza and or COVID-19 consider to taking a 10,000 international unit per day of vitamin D3 a few weeks to rapidly rise the 25 hydroxy vitamin D concentrations, then followed by 5,000 international unit per day. And also this paper talk about the how vitamin D is related to the clinical epidemiological finding for incident and case fatality rates about the like COVID-19 or respiratory tract infections. The possible of the roles of vitamin D for the clinical is given on these tables. Most of the beneficial vitamin D comparing outcomes for participants treated or given a placebo are preferred to establish the causality related to health outcome. However, most vitamin D randomized clinical control trials have not reported that vitamin D supplementation reduce the risk of the disease. In the conclusion of the in the end of the article, but we have another paper that talking about the vitamin D and respiratory infections. This is a systematic review and meta-analysis paper that comes up. The vitamin D supplementation is associated with a reduction in acute respiratory tract infection. Even though the paper have been published in 2017, and we all know that the conclusions, the result, the adjusted odds ratio is 0.88 with a significance p-value 0.003. This is it means that the vitamin D supplementation is associated with reductions in acute respiratory tract infections, and we can see the tables on these slides. All of the the graph in the lines, the right lines, or the more than one out ratio, it could means that the if we have a vitamin D supplementation, we also have the positive association with if we have a high risk to have infections in the respiratory tracts. But for any research results in the lifelines or below the one out ratio, it could be means that if we have a vitamin D supplementations during our treatments, we can also reduce the acute respiratory tract infection, and comes up the final conclusion that all of this meta-analysis result is the odds ratio is below 1.0. So the vitamin supplementation has association in reduction in acute respiratory tract infection. But it is still the correlation or the association study. We are not talking about the causality. If we directly consume a vitamin D supplement, it will be directly reduce the acute respiratory tract infections. And also vitamin D supplementation has the strongest protective effect based on the that articles, the paper, in groups with vitamin D deficiency status below 25 nanomole per liter. So vitamin D dosing requirements during the treatment found that as an important factors, daily or weekly dosing found to be protective, but bolus dosing didn't show any protective effect. What is bolus dosing? Bolus dosing is when anybody taking large amount of vitamin D supplements and they consume not inconsistently some of period of times, they only take a big large amount at once in a while time, so they are not consuming consistently. Bolus dosing of vitamin D supplement in context of this article was described as up to 30,000 international unit per day. That was a huge amount of vitamin D dose, and taking daily or weekly dosing of vitamin D consistently in long period of time with recommended dose are better at reducing the risk of respiratory tract infection between 1,000 to 2,000 international unit per day of vitamin D uh, concentrations. And this is the other impact of vitamin D that working on our human immune system. There are vitamin D can reduce cytokine storm, like the Dr. SD said before, because that's one of the effect of our immune system working in our body is like the immune response of our body producing the inflammations. So vitamin D can reduce the cytokine storm. It could if we are we are not in the adequate vitamin D levels, it could increase the morbidity and mortality in respiratory tract infections like COVID-19. And also vitamin D also reduce the helper inflammatory like TNF alpha and interferon gamma and so on. And vitamin D and COVID-19 do deficient risk a poorer outcome. Is it true that if we have a deficient vitamin D, it will be we will be have a poorer outcomes? That I want to underline and bold, taking a message that a role for vitamin D in the response to COVID-19 infections is have a 2 points or two main things. There are the first one is vitamin D support the productions of antimicrobial peptides in the respiratory epithelium, thus that making us infections with the virus and development of COVID-19 symptoms less likely. And the second one is vitamin D might help to reduce the inflammatory response to infection with SARS-CoV-19 or the new beta coronavirus disease. And also there a study from the UK. The study is called a Confidence UK. This is investigate in how diet lifestyle factors may influence the transmissions of SARS, COVID-19, severity COVID-19, and also what is the effect in any longer terms. And the aim of the study is to recruit at least 12K or 12,000 subjects for this interim results by the summer. So this is in ongoing research of the how the vitamin D as well the impact to the COVID-19. And at best, the vitamin D deficiency will only be one of many factors involved in the determining of outcomes of the COVID-19, but it's a problem that could be corrected safely and cheaply. There is no downside to speak of and good reasons to think there might be a benefit of the vitamin D consumptions. And the conclusion of this presentation is vitamin D has been associated with increased susceptibility to infection like SARS or respiratory tract infections, and vitamin D has been shown to decrease the risk and or severity of respiratory tract infection. And we don't have enough evidence to say that vitamin D is protective against SARS-CoV-19. We only have the association or correlation at this point, like I said before. So few foods naturally contain vitamin D, and this part is also have been talking with Dr. Yatsi previously. For most people, the best way to get enough vitamin D is taking a supplement because it is hard to eat enough through food. But in annotation, if we are in the certain conditions like we are facing in the uh, winter sessions, or we are living in the some of certain geography that could be higher risk, we have the preventable to get adequate sunlight exposure. And also, I want to take the disclaimer at this time is that mega dose supplements that many times the recommended dietary allowance do not appear justified, and this can sometimes be harmful. So be careful to take a very high dose of supplement, and avoid any supplements promoting wild health claims at this time, because the WHO has been monitoring and warning companies offering fraudulent products claiming to prevent, diagnose, treat, or cure COVID-19. And nutritional supplements should not be considered to be substitutes for a good diet, because the supplement contain all the benefit provided by a healthy foods. Okay, thank you very much, and I'm so happy if you have any questions. And
Okay. Okay, Dr. Aji, thank you for the great presentation. So it means the vitamin D is very important to our body to reduce the COVID-19 and influenza. Yeah. So we also can get the vitamin D's in the sunshine, in the sun bath, and the supplement and the food that we eat every day. Yeah, am I right? Okay, can you hear me, Dr. Aji?
yep.
Yeah, okay, okay. Thank you, Dr. Aji, for the great presentation. Okay, we continue in the third or the last speakers. Will be delivered by Mrs. Pratikana. Okay, Mrs. Pratikana, are you there? Hello, Mrs. Pratikana? Can you hear me? Hello? Hello, Mrs. Pratikana? Can you hear me and still join in the webinar today? Hello, Mrs. Pratikana? Are you still there? Hello? Hello, Mrs. Pratikana, are you there? Can you hear me? Okay, maybe we continue our for our discussion. Yeah, when Mrs. Pritikana is ready, we will begin the presentation. Yeah, maybe we start in discussion. There are so many questions in the chat below. Yeah, maybe to Mrs. ST PSD. Hello.
Hi.
Okay. Yeah. Okay. Maybe I can. Yeah. Maybe can you hear me clearly?
Yes, of course.
Okay. Okay. There is a question from Fatima Azahra from Bogor. Yeah. She asking about how to face the new normal life to strengthen our immune system, especially for our vulnerable children under 5 or school age.
Okay, thank you,
Okay.
Fatima, for
Yeah.
your question. Because we are facing new normal to life, and also we should like consider about the virus in our community, because especially for children under 5, because usually the children under 5 don't understand what they should do. Like if they're touching something, they should wash their hands, something like that. Maybe it's better like vulnerable children is only just stay at home, not go anywhere. Because even like go to the supermarket, like children also like usually like touching everything. So
Yeah, I see.
so the important thing. And then maybe the other thing is the children also should have like good immune system. And so this is why maybe the parents should to make sure the food intake of the children like should the food should contain the antioxidant, but antioxidant is usually from fruits and vegetable. Usually children don't like vegetable and fruits. So it's also like the parents should do something, or maybe the supplementation is the last the last chance to give to the children. Or maybe we can maximize the milk consumption, because the children usually like the milk, and then we can like fortify the milk with the antioxidant, or maybe with like supplement of the vegetable and fruits. And also we should make sure also about the vitamin D supplementation, because WHO also recommend to consume the vitamin D, especially during the COVID-19 exposures for children, something like that.
Okay, yeah. Yeah, maybe we can make various meals, yeah, various cook for children, yeah. Usually we can cook omelette and then we hide it, the carrot and the other vegetable in there.
Yeah, it depends on the children, because some children is no problem with vegetable, even like in the big amount. But some children is no, like is little amount of vegetable, then they don't want to eat.
Yeah. Okay. Hopefully Fatima Azara Imbokor satisfies with the answer from Mrs. ST. The second question is from Tamarani Nurul. Yeah, Tamarani Nurul. The question is, are there recommendations for food service industry in workplace or clinics during COVID-19? Yeah, in the workplace or maybe in the clinic setting. Okay.
Oh, yeah. About the food service, the important thing is we should manage the employee health, including the contracted worker, because we should make sure that the worker is not positive virus of COVID-19. So because if the one employee is positive, so it will spread the virus in a food service, not only in a clinic, but also maybe in other places. And we should also make sure about the personal hygiene of employee, because maybe previous COVID-19 pandemic, maybe some employee is very lazy to wash their hand. So now personal hygiene for employees, we should make sure that the employee like have good personal hygiene. And also we also consider about the managed operation in food service establishment or retail food store. So the operation, so the someone or supervisor should manage the operation in a food service. And also we also should manage the food picking up and also delivery, because pick the food and also delivery. We make sure that the deliver or maybe the people who like deliver the food not spread the virus or maybe touch without washing their hand, or maybe they're already contaminated with the virus, something like that. So it is very important because the viruses can maybe stay at a food or maybe stay at a surface of many kind of things. It's maybe around few hours, right? So it is dangerous that if someone, so we make sure that the employee is not positive with virus of COVID-19.
So it must not only the ingredients, but also the delivery that must have the safely place. Yeah. Okay. Thank you, Mrs. ST PhD, for the answer. Hopefully, Tamarani satisfied with the answer. Okay. Maybe the question for Dr. Aji. Hello, Dr. Aji?
Yeah.
Yeah, okay. Yeah, there's a question from Fatima Zahra. Okay. Is it good to consume industrialized supplement vitamin D or high dose with vitamin C nowadays, especially for those who have gastrointestinal ulceration? Okay.
Yeah, it's okay. It's not problem at all.
Hello?
Yeah, it's okay. No problem at all.
Oh, it's no problem. Okay,
Yeah.
so we can consume the vitamin D or vitamin C in the high doses in this pandemic, the COVID-19 pandemic. Am I right? Okay.
And some products provide the multivitamin. There's content not only the vitamin D, vitamin C, that also other vitamin B, vitamin E, and other minerals like zinc and others. That's okay, no problem.
Okay. Okay. So it is safe to consume. Yeah.
It seems that Pretty Kana is already connected, so you can call her.
Oh. Okay. Okay. Maybe
Hello.
Okay. Hello? Oh, hello,
Yeah, am I
Mrs.
audible?
Pratihana. Okay. Are you hear me clearly?
Yeah. Am I
Okay.
audible?
Good afternoon. Good afternoon.
Good afternoon. How are you?
Okay. Mrs. Pratihana. Okay. Are you ready with your presentation?
Yeah.
Oh, okay, yeah. Maybe I will reach out to your curriculum vitae. Mrs. Pratihana is a senior research fellow, Department of Food and Nutrition, University of Delhi, India, and the research associate of Center of Operations in University of West England, United Kingdom. Yeah, Mrs. Pratihana, you have 15 minutes to present your material. Time is yours.
Thank you so much for giving me this opportunity and inviting me to present. I'll start sharing my screen and just let me know if you are able to. Can you just disable the screen sharing mode because it is not allowing me to do that?
Yeah, we're on progress to share your material.
Okay.
Okay.
Should I start?
Yeah, time is yours.
Okay, so good morning, good afternoon, salam alaikum everyone, and I'm here to discuss about a very important topic during this pandemic, which is maintaining mental health through right nutritional practices. Can you just move on to the next slide? So, as we all know, that the global burden of mental disorders, is increasing, and during this pandemic, there is an increased burden of this, depression and anxiety all over the world. And WHO has ranked depression as the single largest contributor to the global disability. Next slide, please. And to understand how this impacts, Autumn has introduced a life cycle based model which maps the relevant risk factors in a chronological order from preconceptional period of one generation to the next generation. Next slide. And as you all know that we are in a lockdown, so our environments have a very important and a potential role to play in our positive mental well-being, and all of our environment further consists of various kind of stressors. So there is a conceptual framework in which these stresses have been classified, and the environments are further divided into personal, social, physical and cultural environment, indicating that environment itself is one of the major stressors right now that we are surrounded with. Next slide, please. Now, to understand the role of nutrition during this pandemic to maintain our positive mental well-being. So as we all know that, the recommendations are to have a good balanced diet. Our diet, if it is deficient in micronutrients like vitamin A, D, E, iodine, iron, zinc, magnesium, and folate, it can interfere with the brain development and the proper brain functioning. Similarly, I will just give you an example of something like, what happens when our diet is low in proteins. I know that everybody over here knows about the hormone, happy hormone serotonin. So serotonin in the body is secreted from a precursor of tryptophan. So, if you don't have the right quantity and quality of proteins in your diet, tryptophan won't be secreted, and further, the synthesis of neurotransmitters like serotonin, which is a happy hormone which regulates our mood, will not be secreted in our body. And probably that can be one of the major reasons that during this lockdown, all of us have a real low mood and we are feeling depressed. Probably we all need to check our protein intake. Again, research studies have confirmed that high sugar, high glycemic index, and high saturated fat diets further promote pro-inflammatory oxidative states and lead to damage and inflammation in our body. And all these damages are further correlated to poor mental health outcomes. Next slide, please. This slide is very interesting as it discusses about the functions of various macro and micronutrients in our brain functioning and formation. And if you see from carbohydrates to pantothenic acid, we need very small quantities of these, but these small quantities play an important role in the formation, development, functioning, and even in the signaling of our messages in the brain and regulating our moods. Next slide. So like vitamin A, vitamin D, vitamin E, vitamin K, you can just, look at the table and see that different hormones are involved in various processes. And Dr. Aji gave you a very good presentation about the role of vitamin D. Again, vitamin D, has again a very important role in neuroendocrine regulations in our pituitary functioning and helps in proper brain signaling. So, having all the nutrients in the right amount and having a balanced diet is what we need right now. Next slide, please. So, can you just go back to the slides, please? Can you just go back to this previous slides, please? More previous, yes, more previous. Yeah, stop. Yeah. So if we just look at this slide, probably we can understand that something like if our diet is lacking whole grains, vegetables, fruits like bananas, nuts, seeds, sunflower seeds, and seafood like oysters and fish. So probably we will get the deficiency symptoms of of the B group vitamins and minerals, and these deficiency symptoms can have an impact on our mental well-being, and probably poor concentration, loss of attention span, confusion, poor memory, psychosis, depression, irritability, black mind, loss of appetite are all related to these deficiencies syndrome. Next slide, please. So we have research evidence emphasizing again, particularly in South Asia, that and even in Asia, all the more that, there are randomized controlled trials of dietary improvement in adults. And these trials are, showing that having a good quality and quantity of diet, including the right amount of macro and micronutrients with dietary diversity and including various food groups in the diet, is related to positive and healthy mental health outcomes in adolescents as well as in adults. Next slide, please. Yeah, so particularly now, if I just focus on this slide, many of you would be experiencing, a binge eating syndrome and addiction syndrome during this lockdown. Sugar addiction, salt addiction, and addiction to, junk food and HFSS food, which is high in fat, sugar, and salt, is particularly of concern during this period, especially in adolescents, as they indulge in snacking and binge eating behavior. And during the COVID-19 pandemic, research has again proven this fact that during this pandemic, people are getting addicted to high sugar, high fat, and high salt products. And all these are again, classified and grouped as junk food. And these junk food lack micronutrients, and they lack omega-3 fatty acids. They are low in proteins, and they are of poor micronutrient quality. They lack the dietary fiber as well, and they have a high glycemic index. And all this is having a poor impact on our brain and mental well-being. Next slide, please. Like I, gave you an example of tryptophan. So proteins are very much important in the diet right now. First of all, to build up on our immunity, but secondly, to keep, keep us happy, because proteins are made up of amino acids, and one particular amino acids like tryptophan is the backbone of serotonin. And lack of serotonin or irregular serotonin production leads to mood disruptions. And without tryptophan in the diet, the body cannot the body cannot secrete serotonin, and serotonin is considered a happy hormone, and it uplifts the mood of an individual. Now, another thing which needs to be taken care is of that to have proper utilization of proteins to secrete tryptophan to further synthesize serotonin, you need to have the right quantity and quality of carbohydrates in the body as well for protein sparing action. Otherwise, every one of us knows that if we don't have carbohydrates in the body for maintaining the immunity, what will happen is protein will be utilized, muscle will be broken up down for fighting against the infection. Similar process also happens with our mood uplifting scenario. So you need to have the right quantity and quality of carbs in your diet, and they should be maintained well with dietary fiber. Right amount of dietary fiber should be included in the diet to help in proper utilization and secretion of tryptophan and serotonin, and to uplift a mood of an individual. Next slide, please. Another important pathway is that, psychological stress is further related to pro-inflammatory cytokines, and there is a bidirectional relationship. Now, what is a bidirectional relationship? Bidirectional relationship means that, there will be inflammation in the body, and depressive individuals will experience this inflammation, and inflammation can also be a cause of depressive illness. So, if you do not consume a diet which is rich in antioxidants, which is rich in vitamins, minerals, and fiber, your body will start secreting these pro-inflammatory cytokines, and it will prone you to more of mental illness. And what is the reason that why this is happening? Because there is a global shift in our dietary patterns. We have started adopting more of Western dietary patterns, and we have left behind our traditional eating patterns in which we had multi-grains, multi-millets, pulses, dietary fiber. And our palate and our plate used to be very colorful. It used to have different types of colors, including the green leafy vegetables, the fruits, and some portion of milk and milk products. But now, as due to globalization and industrialization, again our dietary patterns are shifting. There is a shift in the habitual diets globally, and we are opting more of refined cereals, refined pulses, and high saturated fats and sugars in our diet, and that is leading to the production of pro-inflammatory cytokines, which again pre-exposes you to inflammation and leads to poor mental well-being. Next slide, please. Okay, so now coming to essential nutrition practices that we can practice during this pandemic. These counseling cards and cue cards have been formed by UNICEF and USAID, and in India, we are propagating the use of these counseling cards for anybody who is a frontline worker, who is a health practitioner, who a dietitian or a nutritionist. Why? Because these are standardized cards, and they are available in all the regional languages and adapt to the regional and cultural practices of all the countries. So if you come to the white side of the card, you can see that this card is specifically designed for African and Nigerian regions. So you can even have your country adaptations for these cards. Next slide, please. So, as we all know, and just to give you a brief intro about COVID-19, it started in December in Wuhan, and then in March 2020, it was declared as a pandemic by WHO. Symptoms are again fever, dry cough, or shortness of breath, and some patients may even have body aches, nasal congestion, running nose and sore throat, and diarrhea. Next slide, please. So what needs to be done as a part of prevention strategies is that, first of all, we need to stop the transmission. So transmission can be stopped by practicing social distancing, as well as we should avoid personal human touch with the infected person, or with with any person, because now particularly in India, we are facing a lot of crisis that there are a lot of people who are COVID positive, but they are asymptomatic. They are not showing any symptoms. So what will happen is that probably these people will spread the virus to other people as well. So it is the social distancing is the number one preventive measure that needs to be done. Washing hands regularly, using of disinfectants at home, and whenever someone is sneezing, he or she should cover his face. Next slide, please. So one needs to again take a timely measure if something is seen specifically in children. Why? Because certain cases are being reported of children being infected by these symptoms. Next slide, please. Can we have the next slide? Hello. Hello. Yeah.
Okay,
So
yeah.
what needs to be done for prevention? Basically, even if a mother is considered positive to a child and a baby, so she should not stop the breastfeeding practices. She should continue her breastfeeding practices to develop the immunity of the child, but she should follow the measures given by WHO, that her hands need to be clean. She should maintain a distance. She should practice social distancing and respiratory hygiene by avoiding eyes, nose, and mouth, and by wearing a mask, or sneezing and coughing in a bent elbow, and using a tissue whenever she's doing that. And essential nutrition practices are important to improve the immunity, and that helps in fighting COVID-19 and other infections. Next slide, please. So again, washing of hands is what WHO is again and again recommending, and we at India are also recommending that whenever you are washing hands, you should properly rub the soap between your fingers. You should clean your nails and even your elbows, and at least 40 seconds of scrubbing your hand needs to be done whenever you're doing this, and this should be followed even when a mother is about to feed her child. Before feeding her child, all these practices needs to be followed. Next slide, please. So, if a mother is not able to, yeah, so if a mother is not able to breastfeed spoon and cup, again, proper health and hygiene practices needs to be followed when she is doing that. The utensils needs to be washed. She should be wearing a mask or a cloth to cover her face if she's COVID positive, and if she's not, then it's perfectly fine. And the floor, the house needs to be routinely cleaned, and the play area in which the child is kept, or in the room in which the child is there, that needs to be properly cleaned. Can you please move on to the next slide?
Okay, excuse me, Mrs. Pretty. 2 minutes left.
Yeah.
Can you get?
Yeah, sure. Next slide. Yeah, so again, this is one of the most important slides that we need to take care of. Like I was talking about food dietary diversity, our meals designed in a manner that we are able to include all the food groups in our diet, and our plate should look a little colorful. So what I'll recommend is that, before even practicing any dietary changes in your diet, you should definitely go up and meet up your dietitians and nutritionists, and look up to them, and please follow their advices during these pandemic times. Next slide, please. We should encourage the children to eat foods which are good for boosting immunity, and these are again our seasonal fruits and vegetables, like pumpkin, carrots, banana, and mango, and as they are rich in micronutrients and minerals, as well as our animal foods like egg, fish, meat, milk and milk products, curds, etc., should be given to children to boost up their immunity. Next slide, please. Please avoid junk food. As already explained to you, junk food is again high in sugar, salt, and fat, and they lack micronutrients, and these not only pose a threat to your double burden of malnutrition, but also pose a threat to your positive mental well-being, and maintaining a positive mental well-being is very important during this pandemic. Next slide, please. So again, please ensure food safety by washing your hands and keeping your fruits and vegetables fresh and clean. Remove the germs and wash them regularly before consuming them. Next slide. Ensure safe and clean drinking water for everyone at home. Next slide. Ensure timely immunization, micronutrient supplementation, and deworming for the children, and even for the adolescents, girls as well. And ensure proper iron, folic acid supplementation for mothers, children, as well as for adolescent girls. Next slide, please. These are the specific dietary recommendations which are being given up by Indian Dietetic Association, and that is what we have been following in India. And we are in consensus with ASPEN and American Society of Nutrition, and that is what we are being followed. And something specific that we include in our diet are different kind of spices that initiate anti-inflammatory responses, like turmeric, basil leaves, neem leaves, cloves, etc. And eucalyptus can be used in case inhalation problems are being seen by some of the members at home. Next slide, please. How one needs to keep oneself motivated is that you should practice positive affirmations and take care of yourself. Just give yourself a break and log on to your favorite music or a podcast. Reach out to your family members, talk to your friends, maintain a journal, write down your thoughts in it. You can even blend up your favorite smoothies and make a nourishing beverage for yourself to just uplift your mood. Next slide, please. I would like to end my presentation over here. And these are the publications that are available, so you can just go and check them up and let us know if you have any questions. Thank you.
Okay, thank you, Mrs. Priti Akana, for the great presentation. Hello, can you hear? Okay, thank you for your presentation.
Thank you so much.
Okay, ladies and gentlemen, before we continue the discussion session, I would remind you to fill the evaluation form. Okay, we are waiting for to share the screen in the evaluation form. You must fill this evaluation form, and we are waiting until 3 p.m. today to get your A certificate. You can. This is the evaluation form, and you must, to all the participants, you must fill this link to get your A certificate, and we are waiting until 3 p.m. today. Okay, let's continue to the discussion. Okay. Maybe to Dr. Aji, you have one question. One question more. Okay.
Yes, please.
Okay. This is the question from Hilda and Siti. Which one is When is the best time to get the vitamin D from the sunshine, and how long it should be? Is it enough for 15 minutes or longer than that? And is it should be every day? And the other question is which one is better to get vitamin D? Is it from the sunshine or from the food that we eat every day, or from the supplement vitamin D? Okay.
Okay. Thank you very much for the questions from the audience. So this is the very common questions that we get if we are talking about the vitamin D nowadays. And it is very determining take it into consideration with where we live and how was our geographical typicals. And if we are living in the I'm talking in the Indonesian geography, right? If we are living in the west side of Indonesia, or waktu WIP west, it good if we are exposed from the sunlight starting in the 8 p.m. until before 3 p.m. 8 p.m. until 3 p.m. But the how long does it suitable for us for getting adequate vitamin D from the sunlight exposure is very various. And if you are sunbathing in the 8 to 9 a.m., you will need longer times. So you will need at least 30 minutes, 15 to 30 minutes below the sunlight exposure. But if you are come out at the 10 a.m. 10 a.m. until 1 p.m., you only need less than 10 to 15 minutes. But if you will come out between the 12 to 1 p.m., so you need to use the sunscreens application as well, because it's very very dramatically hot in that hours. And which one is effective if we cut from food or from the sunlight exposure? The answer is, if we were talking about the ratio between the how vitamin D effectively in our body is 90% of vitamin D is coming from the sunlight exposure. 90%. That's why vitamin D is also known as sunshine vitamin, because 90% of vitamin D in our body it's coming from the sunlight exposure, and only 10% is coming from the our dietary patterns from food or from the supplements. Yeah, and what else questions?
Yeah, it's all
Really?
the yeah. You have done your answer.
Okay.
It's yeah, okay. It's clearly enough, I think. Yeah. It's depend on what time we came out in outside, yeah, outside our home. Yeah, is
Mhm.
it? Yeah, am I right? Yeah.
One more, Rina. And how many times that we should
Every
going to outside to get the sunlight exposure? It's not on every day. If you have
ah,
a plenty time that you have free time every day, it's good. But uh, we only have minimum 2 days a week, so it's not so restrictions. If you have to enough vitamin, you have to come out under sunlight exposure every day, 2 until 4 days a week. It could
oh.
be sufficient for us.
Okay. So is it enough in two until four times a week? Is it? Yeah, it is enough for vitamin D supplement for the sunshine. Yeah.
Yeah, basically
Yeah.
the vitamin D is coming from the UVB, right?
Mm,
Ultraviolet B, the type of ultraviolet.
you can
And
add.
the ultraviolet B is basically we can find out between 8 p.m. until
Mm,
3 p.m. So
okay.
yeah, between
Yeah.
there. But if you are coming in the very very day and night in the 12 and or 1 p.m., so you need to sunscreen applications.
Okay. Okay. I think it's clearly enough. Thank you, Dr. Aji, for the answer, and I hope the Hilda and Siti will satisfy about the answer. Okay. Thank you, Dr. Arif. Okay, came up from to the other question is for Mrs. Pretty. Hello, Mrs. Pretty, can you hear me?
Can you? Yeah.
Okay,
Tell me.
yeah, you can hear me. Yeah. Here's there's a question from Miss Rika Sabri. Yeah, Rika Sabri.
Yeah.
How is your recommendation about nutrition for elderly with degenerative disease?
Yeah.
Yeah.
Can you please repeat the question? Elderly?
Okay. What is your recommendation about the nutrition for
Yeah.
elderly with degenerative disease? Maybe the elderly have hypertension or diabetic.
Okay. Okay.
Yeah. Can you explain
So
that?
probably, probably again, what needs to be done is that first of all the parameters needs to be checked as per the patient's condition. So the previous condition needs to be maintained. Whatever diagnosis has been done for all the patients, irrespective of diabetes, irrespective of obesity, irrespective of CVD, that needs to be followed even during the CVD and even during the corona pandemic. And you should again try and follow a wholesome diet with multigrain grains, high dietary fiber, include sources of omega-3 and omega-6 in the diet. Try and modify your cooking oils. You can use a mixture of cooking oils whenever you are cooking the food. So sometimes you can go for oils like mustard oil, sometimes you can use a little bit of palm oil, palmolene oil in fact, and then you can mix those oils. And sometimes sunflower, sometimes soybean oil. So that is how you can just go about using different types of oils. And apart from that, include nuts and oil seeds, include walnuts, almonds, sunflower seeds, flax seeds, chia seeds. They are very much available in the market. And apart from that, include the bran of the cereals, wheat bran, oat bran. Whenever you are consuming your salads, you can just sprinkle over it and just enjoy your meals. And you don't have to worry about your conditions as well. Yeah.
Yeah, okay. Thank you, Mrs. Pretty. And the second question is from Dewi. The question is, how can we manage our meals to get an optimal mental health? The meals means junk food or some kind food that contains a lot of sugar, maybe. Now,
Yeah.
is it not allowed to having that meals at all, or we can manage it? Yeah, maybe you can answer
Thank you
that
for the
question.
thank you for that wonderful question. So what I would like to emphasize is that you need to optimize and prioritize your meals. First of all, the amount of sugar that goes in your daily days intake, you need to optimize that. That doesn't mean you cannot just have a chocolate bar. You definitely can have a chocolate bar, but that means having that chocolate bar in the consideration that you will not exceed 5 to 15 grams of sugar per day. So that is only 3 tablespoons of sugar per day. So again, optimization
Hello?
opting out to eat out, try and opt out for healthier options, healthier versions of burgers and pizzas, where the bases and the
Hello, Mrs. Pretty. Your voice is not clearly enough.
even enjoy the taste.
Okay.
Plus, it has a lot of veggies as well as it has the right amount. Also, it has the right amount of non-vegetarian toppings like chicken and fish to balance out your.
Hello, Mrs. Pretty.
The omega-6 and omega-3 again balanced in your body. Yeah.
Yeah. Okay. Okay, thank you, Mrs. Pretty, for the answer. Hopefully, the participant that asking that question have a satisfaction. And okay, ladies and gentlemen, the next agenda is certificate submission to our three amazing speakers. Okay. Okay, the first certificate will be given to Mrs. Esti Nurwanti, PhD. Hello, Mrs. Esti. Hello.
I thank you for
Okay.
certificate.
Okay, thank you very much for joining us in the webinar today and to share your presentation and knowledge to us today.
Okay.
And the second certificate is given to Dr. Aji. Hello, Dr. Aji. Thank you very much for joining us in the webinar today.
Hello. Yeah. Thank you very much for the certificates.
Okay. And the third certificate will be given to Mrs. Prityakana. Hello, Mrs. Pritikana. Yeah, thank you very much for joining us in the webinar today and to have a great presentation and discussion today in our webinar.
Thank you so much for inviting me. It was a great opportunity connecting with you people. Thank you.
Okay. 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 I remind to all the participants, I remind you again to fill the evaluation form. Yeah, because it is important for your certificate, and we are waiting until 3 p.m. today to fill the evaluation form. Yeah, maybe. Yeah, this is the evaluation form. You must fill this link, and we are waiting until 3 p.m. today. And to all the participants, the material of the webinar today and the certificate will be given to your, the link as certificate and webinar will be delivered to your email. Okay, well, this is the end of the third session. Thank you very much for our three marvelous speakers today. Mrs. SCPSD, Dr. Aji, and Mrs. Priti, thank you very much. And to all the participants, thank you very much. And pardon me as moderator if there are many mistakes in this webinar. Okay, wassalamualaikum warahmatullahi wabarakatuh. Keep safe and healthy during this COVID-19 pandemic. And I hand it back to Mrs. Leah. Thank you.
Okay, thank you, Mrs. Rina, for the time. Okay, hello everyone, still stay with us. Thank you. Finally, we come to the end of this event. To close this event, let's reciting Hamdalah together. Alhamdulillahirabbil alamin. So thankful for our amazing speaker from Southern New Hampshire University, for Dr. Tony, Dr. Lindsay, and Dr. Stacy. So thankful too for Priti Khanna from University of Delhi, India. And so thankful to Mrs. ST and Dr. IG from Alma University, and for Stikes Yatsi Tangerang too. Well, ladies and gentlemen, thank you very much for your coming and your nice attention. See you on another webinar soon. For all the participants who need a certificate, you can follow the link that I have delivered. And then you can fill in the form and send back. Jadi bagi partisipan yang membutuhkan sertifikat dapat mengikuti Bitly yang sudah tersedia. Meskipun tadi banyak yang komplain ya kalau misalkan tidak bisa dibuka, tetapi di kolom chat sepertinya sudah ditampilkan untuk laman yang terbaru Bitly-nya. Oke, kita bisa menunggu.
Hello, Mrs. Leah. Hello, Mrs. Leah, are you there? Hello, Mrs. Leah. Hello, Mrs. Leah, are you still there? Can you continue the announcement?
Hello.
Hello, Mrs. Leah. Hello, Mrs. Leah. Okay, maybe
Hello.
you can continue your announcement.
Mr. Ya have a problem in connection, and so she logged out from the Zoom. So maybe Miss Rina or Aji can help.
Okay, Rina, can you close our international webinar?
Okay,
today?
yeah. Okay, maybe Miss Leah have some problem with network there. Okay, ladies and gentlemen, I will continue what announcement that will given by Mrs. Leah. Yeah, maybe you can fill the evaluation form. Ya, jadi Bapak Ibu bisa mengisi tadi form evaluasi yang sudah di-share. Ya, dan kami tunggu sampai jam 3 hari ini sehingga bisa kami teruskan nanti untuk link e-sertifikatnya yang akan di-share ke email Bapak Ibu semua. Oke ya. Okay, ladies and gentlemen, yeah, you must fill the evaluation form, and we are waiting until 3 p.m. today. And thank you for joining us in the webinar today. Thank you to all the speakers and to all the participants, and also to Stikes Yatsi and Alma University for joining us and to facilitate the webinar today. Yeah, maybe we can join to the next webinar. Okay, wassalamualaikum warahmatullahi wabarakatuh. Have a great day and happy weekend today.
Happy weekend too.
Happy weekend for you all.
Hi, Miss Rina. So we don't have the photo session.
Oh yeah. Okay. So we must. That's a great.
So active your video and we can look our camera and then say yes.
Yes, this is active video and then?
Yeah, I think everyone like Inda or everyone should active
maybe
the video and
maybe
then
all the participants or all can join us in this picture session.
Okay, everyone ready?
Okay, we are on process. We are on process.
Because this is 15 pages, so we should screenshot 15 times.
Okay, yeah, that's a great idea.
Okay, ready? Okay, 1, 2, 3. Miss Rina? Please thumbs up.
Okay, maybe you can wait for a minute. Okay. Apa video review gimana? Biar banyakan begini dia. Galeri. Print screen ya. Okay, are you ready? Jadi begini.
Who shares screen? I think. No.
Wait. Wait a minute.
Bukan video, mau itu, mau foto.
Ini siapa yang screen?
Enggak, maksudnya videonya jangan di-share dulu, mau foto dulu.
Ini jangan di-share dulu, mau foto
bareng. Ya foto di sini. Nggak apa-apa yang ada aja.
Ya, stop share.
Ya. Oke, sip.
Okay, maybe to all ladies and gentlemen, you can thumbs up like this. Maybe. Okay,
Are you ready?
Are you ready? Okay.
Okay, Mrs. Esti.
Are you ready?
Yes. Okay. 1, 2, 3.
Ya, oke. Kita coba dulu ya. Oke. Bentar. Banyak banget soalnya kan. Sama pesertanya atau enggak nih? Oke, sebentar pesertanya kayaknya lagi siap-siap nih. Nah, ini belum semuanya. Gak apa-apa ya. Sleeping tuh ada nggak sleeping tuh?
Okay, maybe it's done for the.
Yeah, I think enough. Hi, Preti.
Bye guys. Thank you so much.
Thank you.
Okay.
Thank you so much,
Thank you so
Pretty.
much,
Thank
Have
you.
a nice
everybody.
weekend.
Thank you. Bye. Take
Bye.
care. Bye. Stay safe. Bye.
Yeah.
Bye.
Mana coba?
Okay, bye everyone. Thank you very much. Thank you for all participant. Kalian boleh leave, boleh silahkan. Terima kasih Bu Esti, Dr. Aji,
Sama-sama Bu. Terima kasih.
Ya, makasih. Sampai ketemu lagi ya.
Sampai ketemu lagi in the next webinar.
Bye-bye.
Bye.
Bye.
Untuk partisipan yang belum,
Kalau ada
apa-apa boleh
info yang di flyer,
boleh di
komunikasi di sana.
komunikasi di sana kalau nggak bisa
evaluation form atau
evaluation form atau YouTube-nya.